I'm leaning towards the anti-gravity ones.
There's some with a bunch of straps.
Yeah,
On the side.
that. I'll send you.
Okay, just send me what to buy.
I'll send you quantity. Hey, 2 for you, 1 for me.
Be good. Oh, matching.
So pretty close.
Yep.
Oh, that was nothing. I'll make you some right now if you want to.
Oh, you plugging that tea over here, Dad?
Oh my gosh. I've got this numbness right here. Here and here.
Yeah,
I'm told it's right up here. Actually,
oh.
she's not buying the whole workers' comp thing. I'm trying to file a claim, you know.
Hey, Dad, will you plug in that tea water?
Absolutely.
It's down here. I have one plugged in upstairs too. You can bring it down if you want.
I was about to make some and try and warm up.
I had too many things plugged in the breaker plugged in. Like I think
Which
I didn't have much plugged in. I just had like that diffuser.
breaker upstairs in the kitchen?
Well, no, I turned it back on, but we just
which breaker for upstairs?
no for this one right there.
Oh, okay. Huh.
So excited how that you come back. I know she just told me that. Yeah, she told me. Should I get a notebook? Huh? He teaches amazing things. Oh, I know.
Amazing things like this.
Yeah.
I'm gonna have a proper
Yeah,
blow.
she told me today. I called her and yeah, she's like, she asked if I knew you. And I'm like, yeah.
I'm gonna get
She's
it
like, I'm gonna let her
heat
in.
up
She did the
stuff.
school.
I just push the button on the handle till it turns red.
Yeah, it's cool. And then I mean, called my mother.
When it's red, that means it's heating.
This lid
Right
towards the sky.
Why?
And this side, yeah, and then this side,
she
it's
is?
like,
Oh, I didn't know that.
and then hands to my
Oh,
heels,
awesome.
and just move my feet into your hip pocket. So it feels really
I want to do that. I want to do
And until it
that.
just yeah. Oh, you feel it? Yeah, that's pretty bad. You gotta keep that. Yeah. I know, right? What do you have to wait for?
I didn't.
You know those church feelings?
You're gonna start shaking? Yeah. We'll have to, yeah, we'll have to have some safety measures in effect.
So nice to meet you. Do you guys know if she got an instructor? Purify's looking for one. Oh, really? Purify will stick, does it? Does she? Yeah. I didn't know that. You know, I thought she would want to be. I want to do that at some point. I want to be certified too. I mean, I guess you could, like, so you know.
Just bend your knees, feet together, hands on the top of your feet,
You certified me.
and let
Oh,
your
you're doing this? I want to do that.
head tilted.
Oh, sorry. You know. Hello. Oh, is it even raining? I should have saw it. No, I wasn't raining. I don't want to go to get a notebook. I forgot mine. You can just.
Yeah, there's a heated one upstairs if you want to bring it down.
I do want
That one should be all hot.
Thank you.
What
Oh, let me
temp is-
find
I don't know.
I'm sad I wasn't able to make it last week.
Last week, well, we can send you the recording if you want it.
Yeah, I probably
I do that,
Well,
actually.
it is, but it isn't. I have read the L.A. so.
Nice. So you're-
But it was a long.
We talked about the Dow issue last week, so, yeah, like when you started.
You know what I mean?
Yeah.
Inside the closet.
Oh,
It's just like you
Yeah,
said,
I'm
when
not
it's
sure.
cold. I don't know now I know exactly what it means. Chin towards your chest. Oh, relax.
Hey, how are you? I'm so good. I was just telling them we need a Qigong teacher for Purified. They're looking for, they're looking for someone. We're yoga friends. Oh, yeah.
You look familiar. I think I met you. Purified.
Yeah.
Yeah. We talked once. I'm pretty certain of
Yeah.
that.
Are you, do you go to school class?
I've been to it, but I don't usually go to class.
Oh.
I teach the yoga class.
Oh, that's where it is. And I would always be in the class.
Yeah, with Tiffany.
Yeah.
No, yeah, that's where I was like, that was right after Tiffany's class. Heidi, Black Logan.
Okay.
Oh,
Erin.
Oh, wait, you know Erin?
Yeah. Oh, yeah.
Erin Black Logan? My sister.
Yeah. I don't do
Yeah.
Yeah, we're friends.
Yeah, cool.
We used to live, like, we did PTA together.
Oh, nice.
Yeah.
Okay, tell me your name.
Melanie. Yu.
Melanie, you
She lives in Alpine.
Hey,
Hi,
Mel.
how are you?
Good.
Good. I'm like so jealous right now.
Do you know
I know,
Eric?
me
over
too.
here?
Yes. We
Okay,
met at
nice.
Corey's.
You do?
That looks
We
super
met at
fun.
Corey's.
Oh, okay.
Yeah, yeah.
Wait a minute.
Yeah.
Oh, yeah, with your daughter and the bag full of goodies. I totally remember you, yeah.
Oh, she's here right now.
Hi, Lily.
Where do you do yoga? Oh, that's right. Oh,
So
man.
how do you?
Yes.
Like what the Ben has in his room.
Seriously, I want to do
Well.
Oh, that'd be nice.
Yeah.
You can't
Drinking tea and doing our yoga.
On the acupressure for that, yeah. Okay, this arm threads around the inside of the leg. And you grab my heel. Do the same thing with this arm. Take your chin to your chest. And then move my feet into your hip pockets. And then you can just let your arms come behind you and release the fingers.
That was the first question. Take a picture of it. I don't know if it's no, it's not. Love to take a picture. That was from the first class.
Feels good. Sorry.
Sorry. I know. How do we sit between you?
And then grab opposite elbows. Behind your back. Keep your head heavy, keep your feet heavy. So heavy your feet heavy. Feet your legs up wide.
My folks is maxed out on, like, I gotta start deleting stuff or do something with the same and stuff on my storage. No, I was just.
Yeah, wait, in yoga. I met her. Oh, yes. I met her in yoga right before. Oh, you were there? I was at. She told me.
Yeah, I think because my.
Better those blood flows.
Feet down to the and then opposite elbows. Get that? Yeah, we can. Let me know if this is okay.
Oh, that's fun.
It is.
I don't know what they got.
So anyway,
Oh,
Should we get started? 7:09. Seth, do you want to get started?
yeah, now we're doing this. We're doing this. Straight up, straight up, straight up.
Okay. Oh, gotcha. The other Heidi. There's two Heidis. So Heidi's
Wait, I'm
right
gonna go grab my notes. I'm like, don't know what I was thinking. Steph, I'm jealous. I want to do that.
It's so fun.
Is there a class?
Let me see.
Talk to him. He's an expert. I had the easy part. It feels easy when he's on the bottom.
Okay, I forgot.
Oh yeah, that's the.
I'll be right
Yeah,
back.
yeah.
Can you believe Eric's doing chat with yoga? I'll be right back.
Hey, friends. Thanks for coming. It's great to be here again. Thanks so much to Seth. I don't know if I should tell you this, but this is kind of like a highlight of my week, lest you think that like my life is like this is the only interesting thing I'm here with. But yeah, this is super fun. I love your glasses. Thanks. Seth. Does everyone? I'll just run through your experience. Seth has a master's degree in Oriental medicine from the Maryland University of Integrative
Health.
Health.
Yeah, nice.
And then he is also on the faculty there, as well as at the University of Maryland,
Virginia.
of Virginia School of Integrative Medicine.
Nice.
Yeah, he
Something
studied
like that.
in Taiwan for a year under Dr. Lee and worked at a clinic with him. And has been in practice as an acupuncturist for 8 or 9 years in DC area. Recently sold a practice in Boise and moved down here and is establishing one here locally. If you're interested in acupuncture, contact him, and he is practicing here in Alpine and probably in Orem too, eventually. He's been fixing me up, and it's exciting to see the potential. So thank you. There is some tea over here if you need anything else. Oh, you can Venmo Seth 25 for the class or 80 for 4 classes. Or cash or check is even better. I don't know if I should mention a spoiler, but
Spoiler alert. Okay.
there could be classes in February.
There could be classes. Yeah, there could be classes upcoming in March, right? You mean?
Oh, yeah, this is February.
She's been upside down.
Yeah. Well, so we had a couple weeks of more, theory establishing some basis of the context, the history, a little bit of yin yang theory. Last week we talked about Taoism. And this week we're going to go into just kind of like a basic primer of acupuncture. What is acupuncture? So when we talk about Chinese medicine, first of all, Chinese medicine is medicine that originated in China, right? I mean, and back, historically in China, it's just medicine. It wasn't like Chinese medicine, it's just medicine. And then once Western medicine was introduced in China, first with the missionaries in the 1500s, but then later, in a larger scale in the Industrial Revolution, mid to late 1800s, then Western medicine became a lot more prevalent, and then they established these terms of Zhongyi, Chinese medicine, to distinguish from Shi or Western medicine. So then there was that distinction. And so when we talk about Chinese medicine, now at this point, we're talking about the constellation of practices that are based on the foundation of Chinese medicine, the foundational principles of yin yang, 5 elements, and other kind of, philosophical foundations, as opposed to Western medicine, which has a different foundation, different system. And so anyway, when acupuncture, what is acupuncture? I'll give you the short answer, and then we'll have the long answer, which is the rest of the class. But the short answer is a little blurb when, if I were to see a patient for the first time and they ask what is acupuncture, or if they've never had acupuncture before, I might explain, okay, acupuncture, well, the technique is really, really simple. Understanding the theory and the science behind the different actions of the points, that can be complicated. But the technique is really simple. We use sterile, disposable, single-use needles, very, very thin needles that we insert in particular points in the body to stimulate the circulation of blood, of body fluids, and of what we call in Chinese medicine, qi, energy, which resembles your nervous system. That's kind of like that's usually like enough for them to just be like, oh okay. Then they might ask more questions, but that's kind of the, what I say to just keep people at bay or keep them interested or give them a general overview. And so, like I said, in that short definition, the technique is very simple. The theory and science behind the different actions of the points, that can be complicated. So we'll get into a little bit of that today, of that complicated part, and as well as look a little bit about the history of acupuncture and a bit about the mechanisms from a Western medicine perspective, from a Chinese medicine perspective. And then if you guys have any questions at any point, just feel free to ask. So first, let's look at, I kind of want to get a little, what I think is like a little bit more of the boring part out of the way. Maybe you guys won't find it boring, but when we look at the mechanisms of acupuncture from a Western medicine perspective, okay? So from a Chinese medicine perspective, when we stimulate the point, we stimulate the qi, right? But Western medicine, we don't have any concept of qi. But if we map that out onto the Western mind, then we do have some mechanisms, right? And so one of the things I want to get across is that like qi is not like a abstract, like woo-woo weird thing, right? It's just the Chinese medicine concept of this life force. Life force. We could be talking about the nervous system, circulatory system, respiratory system, lymphatic system. Like it has a physical, like qi is physical. Okay, that's one of the things I want to convey. It's not, we can think about it in a more ethereal, energetic term. Yeah, it is that too, but it's also very much physical. Like when we insert a needle and we stimulate a response by the body, that is a physical as well as energetic response, right? So that's one thing that's worth saying, is that acupuncture is a physiological practice. And so some of the mechanisms of acupuncture from a Western medicine perspective based on research, so all of these things that I'm going to say have like research studies to back them up. So if you're interested in the research side of it, I can send you the citations of these things, and as well as some other resources about the mechanisms of acupuncture from a Western medicine perspective. Like I said, I think this is more the boring part, but it's important to know this is the mindset that we think about, a lot of times, that what we're thinking about. So one of the things acupuncture does, it improves circulation by enhancing the generation of nitric oxide. Okay, so nitric oxide is a vasodilator, meaning that it relaxes the inner muscles of your blood vessels. So that means it increases blood flow and regulates blood pressure, right? So we have this effect of acupuncture affecting blood circulation. Like I said, it affects the circulation of blood. Also in releasing nitric oxide, it releases muscle tension and pain by stimulating and breaking up bands of bound muscle fibers called trigger points. Okay, so when we stimulate a point, it breaks up adhesions, breaks up muscle bands. Acupuncture also relieves pain by producing endorphins, which are your body's natural opioid-like peptides. Okay, so a lot of studies now showing acupuncture is, equivalent or similar to opioid medications to treat pain. Okay, and how that works is that when we stimulate an acupuncture point, it basically releases your body's natural opioid-like peptides, such as these things called beta endorphins, endomorphine, dynorphin. These are your body's natural painkillers. So all of these things that are released have an analgesic or a pain relieving effect that's similar to the opioid drugs, but without the side effects of opioid drugs, right? So now we have like an opioid crisis, right? Because in terms of treating pain, in terms of treating chronic pain, in Western medicine, their options are kind of limited, right? Has anyone here like experienced, chronic pain or acute pain or an injury that is slow to recover? Like if you go to the doctor, what usually happens? Like what would they recommend for treatment? You guys can tell me, but in my experience, you have chronic pain, you recommended physical therapy, NSAIDs, right? Like pain relieving drugs, or if it's more severe, maybe surgery, right? Or maybe these opioid drugs, right? Nerve studies, so maybe more diagnostic studies to see if there's something going on with the nerves, maybe even doing nerve block treatment, right? Wherever they go in it, they have the nerve block the nerves from sending the pain signals. What else do they do? They might inject topical, or they might inject cortisone shot, right, to like block the body's response. So those are some of the things that they do for pain. But even in Western medicine, they acknowledge they're not really that good at treating pain, right? I mean, sometimes, like let's say with the topical, or not the topical, but the steroid injection, the cortisone, that may help for a time being. It might be enough to resolve it, but rarely. Sometimes it makes it worse, sometimes it makes it better, sometimes it stays the same, a little bit unpredictable. Then otherwise, physical therapy, while a very important modality for injury rehabilitation, right? Retraining muscles, increasing mobility, increasing strength, doesn't really treat pain, actually. I mean, there's nothing about physical therapy that treats pain directly. Good for rehabilitation, right? And so we have this kind of crisis now, an opioid crisis, right? Because opioids treat pain really well, but they're very addictive and have a lot of other side effects. And so now acupuncture is getting popular in terms of solving the opioid crisis because, well, actually acupuncture is similar to opioids in their effect of treating pain, but without the negative side effects, actually with a lot of positive side effects. Question?
Epidural blocks.
Epidural blocks. Mm-hmm.
How close can you get to that, would you say?
Mm-hmm. Well, different mechanisms. So, when we use acupuncture, well, acupuncture can, in a way, be used to block pain or block pain signals. In fact, acupuncture is used for analgesia, as an analgesic. And acupuncture is used for surgery, actually, as a anesthesia for surgery in China. So it can be used for that effect, but usually when we use acupuncture, what we want to do is normalize the circulation, right? Like if there's pain, that indicates that there's some issue with this, that the circulation is not moving freely as it should be, right? There's a saying in Chinese that, when there is pain, there is no free flow. When there is free flow, there is no pain. So when things are flowing properly, so with acupuncture, we usually don't want to block the pain. We want to actually get everything moving the way that it should be, right?
Does laser acupuncture work the same?
Right, laser similar. Yeah, just basically stimulating the point, right? So we can stimulate a point or stimulate the body in many different ways. Acupuncture is just stimulation with a needle. And so when you actually needle the point, there's different things that happen than versus laser. I mean, laser has its own benefits as well. But, people are like, oh, can I just do acupressure instead of acupuncture? Yes, it will stimulate the point, but it's not the same as when you needle, right? Because we're going to a certain depth. We're stimulating a particular way. We're activating this the peripheral nerves. So there's something specific about the needle actually that does things. What's another thing about acupuncture? We're kind of getting a little bit ahead of ourselves with talking about this, but we're going to get there soon anyway. But needle is conductive, right? So when we insert the needle, it's conductive. The body is electrical, right? So the acupuncture also affects what's called the piezoelectric system of the body. So when we stimulate these points, it's conducting the electrical signals through the muscles, through the nerves, increasing the brain-body connection as well. And so, yeah, it releases your body's natural endorphins. Another thing acupuncture does is activate the parasympathetic nervous system, which is the body's rest and digest state in which healing can occur. Right. So when our body is in a state of stress or the sympathetic nervous system, the fight or flight mode, we instead experience increased muscle tension, blood pressure, and inflammation. So acupuncture in general, kind of like regardless of what point we're doing, it activates the parasympathetic nervous system, can get us into the state of healing. That's why I could be treating someone for the wrist pain, right? But they still can have this other systemic effect. And when the parasympathetic nervous system is activated, everything gets better, right? Sleep improves, digestion improves, and so on. And it's not like we should be in parasympathetic all the time, right? We need to be able to activate the sympathetic nervous system and, be in that fight or flight. But the point is that we can go back to parasympathetic, right? It's not like we want to be like catatonic all the time. We want to be able to be active and then rest and have that modulation. So acupuncture brings us to parasympathetic so that we can access that more readily, kind of like training our nervous system, actually. So the more acupuncture you get, it's kind of like training your nervous system to be able to relax, to go into that parasympathetic state in which healing can occur. These are kind of general effects of acupuncture.
So in the surgery room, would an acupuncturist in China come in as an anesthesiologist?
They do actually. They do that sometimes. Here? Yeah, so they'll do scalp acupuncture, and so it's actually really fun. Not here, only in China.
Yeah, that's what I mean.
But it's actually funny because sometimes if people check their insurance benefits with acupuncture, the insurance will say, "Oh, you have acupuncture coverage." But then if you ask into it, they'll say, "Yeah, so you have acupuncture coverage for anesthesia." Patient's like, "What? What does that mean?" Basically, it's kind of a funny, tricky way that the insurance company can say that they cover acupuncture without covering acupuncture because no one uses acupuncture for anesthesia in the United States. It's like a weird loophole kind of thing. It's just kind of a side note, but just to say that, yeah, acupuncture is used for anesthesia sometimes in China for minor surgeries, not for like, as far as I know, not for like, huge, open heart surgery or things like that. No, you want to put them under. But for more minor surgeries, you can use it for the analgesic effect, and then then do surgery.
Did you experience that or practice that at all?
I didn't see it while I was there. Yeah, I didn't see acupuncture for anesthesia.
I have a pretty common health insurance cover
Mhm.
here,
Mm-hmm.
And I can go 10 times a year.
10 times a year. Yeah. So depending on the acupuncture coverage, all the policies are different, all the plans are different. They might cover only low back pain. They might cover this, they might cover that. There's all different, and they might cover just for anesthesia. But probably not. That does, but I've encountered it probably like 20 times. Like it's one of the questions we have to ask if we're verifying the insurance, like, is it acupuncture for anesthesia only? Anyway.
My real question,
Oh yeah.
Acupuncture stimulates your nervous system.
Yes.
What is dry needling?
Yes, we'll get to dry needling.
Okay.
We'll get to dry needling. No, don't be sorry. Great question. Yeah, we'll get there. If I don't answer it, ask me again. But we'll get there in a little bit. A couple other things acupuncture research wise, and we're not even going to cover everything that acupuncture does from a research perspective, but just a few things. Acupuncture has been shown to regulate the immune system by stimulating production of cytokines, T cells, and B cells. Okay. And also there's this study of what happens when we have what's called in Chinese, da qi, the arrival of qi. So this is a subjective thing that the person experiences when the needle stimulates the point where you feel a sensation. And that sensation can be sometimes achiness, heaviness, tingling, electrical sensation up or down. That's what we call in Chinese da qi, the arrival of qi. So it's through research, it's been shown that when you obtain da qi, there's these other things that happen. Because sometimes that doesn't always happen with acupuncture. Sometimes you don't feel the needle at all. And that still can be doing something, but not the same as when you have the stimulation of the qi. We're activating the nerves in a particular way. So research showing that there's a relationship between the da qi, which follows the contraction of, this is going to get a little bit technical, contraction of fibroblasts surrounding the needle after manipulation, the da qi sensation, with its propagation along the channel, which is the acupuncture channel, which is consistent with the stimulation of the sensory mechanoreceptors and with the wave of stimulation along the planes of connective tissue filaments. Okay, so when we stimulate this point, you feel a sensation along the connective tissue planes or along what we call the acupuncture channels. And so this has a downstream effect when we needle this, including cellular polymerization, changes in gene expression with effects on blood flow and cytokine synthesis, which may result in long-term modulation of the activity of the sensory system inside the connective tissue. Okay, very, very technical. I'll explain a little bit. But basically, the sensory afferents in the connective tissue are the mechanism that's involved in a lot of chronic pain or chronic diseases, such as neurogenic inflammation and chronic pain. So essentially, when we're stimulating, interrupting, or what we call neuromodulating the muscles, we're basically interrupting these pain cycles through the nerves. So this neuromodulation. So neuromodulation is defined as the alteration of nerve activity through targeted delivery of a stimulus. Okay, so neuromodulation, the alteration of nerve activity through targeted delivery of a stimulus, such as electrical stimulation or chemical agents to specific neurological sites in the body. Okay, so basically, one of the main things that acupuncture does is it neuromodulates. Okay, it alters the nerve activity throughout the body. So, acupuncture, for almost 2,000 years, they're very concerned with channels, right, or meridians. And so you see these charts of all these meridians. They're basically mapping out nerve pathways, and so what's one of the main symptoms when you have a heart attack? Numbness down your arm, right, your left arm in particular. So that's the heart channel, right? So that's one example. We can experience symptoms along a particular acupuncture channel based on dysfunction of the organ, but that connection goes both ways. So we can stimulate that nerve or that heart meridian to actually affect the function of the heart as well. Okay, so this is neuromodulation. Any questions? This is the very technical part. Okay.
Okay, so if the chi flows out from the heart channel out this direction, you're saying that by stimulating it with the needle, it somehow will stimulate the chi flow
Circulation, yes.
something to come back.
Yes, and so but particular acupuncture points will have specific effects as well. So different parts of the channel, we can needle any part of the channel to affect overall circulation in the channel. And that channel, because it goes to the organ, the acupuncture channels are seen as basically kind of like the root, whereas the organ is kind of like the fruit of the tree, as it were. So like if we imagine these acupuncture channels as like the tree with the organs as the fruit. So it's like people are like, I got my gallbladder removed. Does that mean that I don't have a gallbladder channel? You still do. You actually, you might have issues actually that led to that gallbladder problem in the first place. But the nerve is going to stay there. The channel, the nerve pathways, and so another example, like the sciatic nerve that runs down the back, right? So we can trace that nerve pathway. If you have an issue here, in this part of the nerve, it's going to create issues downstream, right? And so an acupuncture perspective, we'll use a lot of points here downstream from that on the same channel to remove the obstruction, to get the blood, chi, and body fluid circulating in that channel. So yeah, if someone has like a heart issue, it's not so simple like we just needle this one point on the heart channel, because it could be other issues that's going on. Different acupuncture points have different effects internally on the body. Like maybe they have a heart problem because their body's not metabolizing fluid well, right? Congestive heart failure because there's too much fluid. So we need to work with the body's metabolism of fluid. And so particular acupuncture points to address that issue, et cetera. But just in a general sense, yeah, when we stimulate a point on that channel, it's going to stimulate the overall circulation to that organ as well as to that channel. And then particular points on the channel have more specific effects. Yeah.
How much experience do you have working with people who have sciatic pain?
Ton, all the time.
Like,
Yeah.
How
easy. That's
how
like
effective or how quickly can
easy, like one session or two. Really easy. Yeah, it was one of the
because I have
yeah.
people come to me like as a
Yeah.
massage therapist, and I mean I can't like cure it. I can
Yeah.
kind of comfort it.
Yeah. Yeah. No, that's a pretty easy one. I mean, if there's a total herniation, the body can still heal from a herniation, total herniation actually on its own, but it can be very painful in the meantime, right? The body can heal itself, reabsorb that of a disc, right? Like, so like with the spine, it's almost when I have a herniation, or like it's kind of like the jelly has squeezed out of the donut, basically. Like that's what happens, where you have all this like fluid in there in the spine, and then when it gets herniated, pulled, it can rupture. And so that actually, like literally, like all that stuff comes out. And so when you get surgery, they come and get everything, they put it back in, and they repair that area, kind of set it in place. But the body can do that reabsorption on its own. And I've seen that. Like I've seen people recover from severe herniations.
How long?
Would that take?
Because I did that. It didn't work.
Did what? Surgery? Or?
I did acupuncture on my L5S1. Like I did
L5S1.
it.
Yeah.
But
Yeah.
I ended up
How many
having-
sessions did you do?
I did it for 9 months.
9 months.
But
Yeah.
I had to. I had a dissection.
Yeah, surgery can be really good for that. But no, I mean, it would, yeah, like if I was seeing that, I would do 1 month of intensive treatment. And if it's not 50% or 75% better after 1 month, I would recommend surgery. But there's, it's like, yeah, so, it's like frequent, it's like, what were they doing exactly? Acupuncturists, what exactly were they doing? What was the frequency? With acupuncture, I've kind of said this before, but one of the issues with acupuncture in the United States is an issue of dosage. And what I mean by dosage is frequency as well as intensity. And so, sometimes the treatment could be okay, but the needle stimulation, we'll talk a little bit today about needle stimulation might not be right. The points that they select might not be right. Not that there's one right way. And then the frequency might not be correct. And so, for a severe pain condition like that, the frequency would need to be 3 times a week, at least 3 times a week, with strong stimulation, strong treatments, right? And so like in a way with the intensity of acupuncture needs to match the intensity of the situation, right? So for more mild conditions, we can do more mild treatments. For more severe, we need to do more severe or more intense treatments in a way.
Yeah, I didn't do that many. I wish I would.
Yeah, so that's one of the issues. And sometimes that can be a matter of pricing, right? Because like if it costs 150 per session, you might not be able to do 3 times a week, or what, so anyway, different medical system in China there. Like they have a national healthcare, right? So when they go to the hospital, and there's private clinics as well, but let's just say you just go through the healthcare system, you go to the hospital, you can get acupuncture every day, it costs like $2 to $4 US. But that's like the medicine for the masses, right? It might not be the best, but it's like you can still get pretty good, probably better than most in the United States for $2 or $4, right? For out of pocket, right? The government is paying for it, but yeah. Anyway, any questions about the the mechanisms of acupuncture from Western medicine perspective? I'm trying to think if there's anything else.
Or whatever, but I have had acupuncture by a chiropractor who just did like some weekend training.
Dry needling.
So how is acupuncture like regulated?
I can answer that now. It's a good question. So this is an interesting topic because it's a little bit of kind of now like a turf war, I guess, between like physical therapists, chiropractors, and acupuncturists, because to get an acupuncture license, you need to have completed a master's program in acupuncture, which is like 3 years study, right? Master's degree in acupuncture, 3 year study. It's actually in between like a master's and doctorate, right? A lot of times master's programs have 3 or 2 years, right? But this program is 3 to 4 years usually for master's of acupuncture. So you finish, get your master's degree, and then you get nationally certified. So you have to pass board exams. So 3 different board exams in order to get national certification, and then with that national certification, then you can apply for state licensure. That's basically how it works. Kind of similar to physical therapy, becoming a physical therapist, or becoming a doctor, in a sense that you have to complete the program, take your board exams, national certification, state licensure. It's like that. However, chiropractors and physical therapists, this modality of dry needling is getting pretty popular. That's basically seen as kind of like an add-on certification for a chiropractor or physical therapist. So basically they can take like a usually 2-weekend seminar, and then they can be needling people, and they're pretty intense needle, like they're not subtle. It's kind of like sloppy, but they do get some good results, but it also can be a bit of a safety consideration, because their training is kind of minimal. They do know a lot about anatomy, like physical therapists and chiropractors, but their training, and we're going to get into more what is dry needling when we go through different styles of acupuncture. I'm considering dry needling as a style of acupuncture or tradition of acupuncture.
So what they would be doing is dry needling?
Dry needling. And they're very careful usually to not call it acupuncture, because if they call it acupuncture, then they're malpractice, because they're practicing acupuncture without a license. So they're usually very careful to say, oh, no, this is not acupuncture, this is dry needling. And dry needling is better because it's more scientific. And acupuncture is about qi, and this is about structure. So this is better, actually. So that's they're very careful usually to say it's not acupuncture, it's dry needling. So we'll look into what dry needling is. And
the minimalist education that they have around it, is there a potential for harm or just ineffective?
Both. It can be effective, sometimes can be ineffective, but it is a safety issue, because some of the techniques that they're doing, well, one, it can be very painful, so people can have a bad association because it's super painful. 2, it can be actually harmful because of the lack of training. So, acupuncture is very, very safe, but there's some areas, that you need to be a little bit more careful. For example, if we're needling, a trigger point on the upper trapezius, right? This acupuncture point called gallbladder 21, this point right here, and which is a common area where people have a lot of, it's a trigger point. A lot of people have a lot of pain and tension here. And so if you're seeing a dry needler, a physical therapist doing dry needling, they would do this dry needling technique, which involves like rapid lifting and thrusting technique in order to break up the adhesions, which I do this technique. I like it. Nothing wrong with that technique. It can be helpful, but there can be doing this deep, needling technique on this area, which can puncture the lung, because the upper portion of the lung actually comes quite high up here. And so, you need to be very careful with techniques up here, that you do up here in terms of the depth and what you're doing and things like that. So that's something that we're trained a lot in acupuncture school, that we, very careful around needling these areas. So they might be overly aggressive. And there's been a lot of cases of what's called pneumothorax, or puncturing of the lung, which usually it can be really bad. Usually a more mild pneumothorax, the lung tissue, it will just kind of heal itself. But it doesn't always, it can require surgery, actually. it can cause a lung collapse, right? So it is a safety situation. I don't like, there's other acupuncturists who are, very advocates. They want to advocate to take away their right to do that. And for me, I want to focus on my own practice and just do what I do well, rather than taking something away from other people, because it can be seen in another way. Like, I don't want to overstate the safety issue, because that has happened, but it's not like most of the people doing that are causing lung, collapse and things like that. But
comparatively the pharmaceutical risk.
right, for sure. There's risk to any treatment, and there's a lot of treatments out there that are, very risky, and people have a lot of side effects. So I can't even say whether the risk outweighs the benefit, because the people are benefiting a lot from that treatment. But I would like for them to have good training, and that's so anyway. And yeah, there's a lot of acupuncturists who maybe are doing malpractice, not necessarily doing a lot of harm. I think acupuncture school is really good at training people to not do harm, but in terms of efficacy could be down, just because of the limited training. Like, acupuncture school prepares people to have the bare minimum in order to like treat patients and not harm them, but in terms of efficacy, it's not that great. Okay, let's see. So now let's look at kind of like from a Chinese medicine perspective, the history of acupuncture, and a little bit about how this practice came to be. I mean, first of all, it's worth saying that we don't really know how it came about exactly, the development of it, because it's very old. So there's kind of limited relics and records of the development of acupuncture. It's almost prehistorical. But the evidence that's out there suggests that acupuncture has been practiced for at least 3,000 years, right? So since at least 1000 BCE. The first definitive systematic organization of acupuncture with a description of the system of acupuncture was the Huangdi Neijing, Yellow Emperor's internal classic, the Huangdi Neijing. So, and no one knows exactly when this was first written, but several prominent scholars believe that it was dated from the 2nd century BCE. But we know it's at least from 100 AD. And so this text is a very important text, one, because yes, it outlines the system of Chinese medicine from a philosophical standpoint, as well as from a very practical standpoint. It has 2 books called the Suwen and the Lingshu, right? So the Suwen are the simple questions, and the Lingshu are what's called the spiritual pivot. There's actually 2 other books that did not really survive much, but there's at least 2 books that we have. This is more philosophy, cosmology, and this is very specific in terms of a lot about acupuncture and some about herbal medicine. So anyway, this book is a very important book, not only because it outlines this Chinese medicine philosophy and system, but because it represents a dramatic departure from the old ways into the new ways. Okay, so the Neijing represents the shift from shamanistic tradition, shamanistic beliefs that disease was caused by demonic influences, right? So that was the prevailing belief at the time, right? We see that in a way in Europe as well around this time, where we have a more medical perspective. So at this point, it's saying that no, diseases are not because of demonic entities. Diseases are because of the laws of nature, and there are laws of nature. And so these laws of nature are from a Chinese medicine perspective, the laws of yin yang and the laws of the 5 elements. And it's seeing the human being as a microcosm for the macrocosm of the earth, of nature itself. And so it outlines the causes of disease. No, they're not demonic entities. We have specific causes of disease. So we have external causes. We have internal causes. And we have miscellaneous causes of disease. Okay, so the external causes being climactic factors. Prolonged or excessive exposure to the elements, cold, excessive exposure to cold, heat, wind, damp, summer heat, etc. Internal causes, emotions. Okay. And the miscellaneous causes, basically being other things, diet, toxins, etc. Lifestyle. So these are the causes, right? Pretty huge. So this is, this is the, 2nd century, and they're outlining the different causes of disease and why we need to identify those different causes. So, so that was huge. So this is, and so it, now we have a system, and now we have a very specific system actually of how to treat disease that this book outlines. Any questions on that? The Huangzi Neijing.
What year was that? The second
This was between the 2nd century BC and the 1st century AD, sometime in that time period. Actually, well, I already started erasing. Any other questions or thoughts?
Comparable outline of disease come about in the West.
Well, I think around that same time when we have Hippocrates, right, which is a little bit later, right, Roman Empire. No, Greek. Hippocrates is when, like, I have to look it up. 4th century. Hippocrates, Greek physician. So this is 400 Common Era. So not that much long after we had, like, Hippocrates is one of the first to kind of systematize medicine in terms of the humors and this and that, right? So okay. So one of the things that getting into acupuncture, one of the things that the Huangzi Neijing describes is the 9 needles, what's called the 9 needles of acupuncture. I'm going to share this, do a little screen share for the people online. Oh, I was going to use my iPad to show the rest of you, but I'll show the rest of you in a moment here. So we have the 9 needles. I'm gonna pass this around for you guys to look at, where we have these 9 different styles of needles for different purposes. So some look more like a sword, thick, right? Some look like a sword. And then if we look at maybe number 8 or number 9, where it says filiform, the filiform needle, that's the needle that resembles what we use more commonly today. Filiform needle.
Do you usually always use the same type of needles or different needles?
Yeah,
different things?
different. So like I just have a few different kinds of needles, different sizes. These are mostly all small ones, but these are examples of that. I don't know, what is it, the 8th one or the 7th one or 9th one? The filiform, small filiform needle. So some of these needles you can look at.
I'm closing my eyes and just listening.
In the there's a column that says uses in there. So, some of these ones were used to drain pus, for example, or used for bloodletting. And then others were used for like a massage, like one that's more like scraping massage.
Wow.
And then we have the filiform needles. No.
No, thank you.
So here,
On the top one.
these are just a few tiny, different sizes. So this is like the smallest one. This one is about a half inch. This one's about an inch. This one's about 2 inches. Yeah, right. They're super tiny.
Yeah.
So these are some examples of very thin, modern acupuncture needles. Very thin. This one's actually the thickest one, but so
I'm figuring out.
okay, it's got all around.
Not actual size.
Not actual size. Did you guys see it? Okay, so check that out. So these are examples of, I guess, would be the number 7 fine needle. So the filiform needle. Filiform means solid and wrapped like this.
Look at that first one,
This
spade.
handle is wrapped.
Yeah.
Anyway, filiform needle is solid. There's nothing in the needle. It's solid. The needle is just to stimulate something within the body. Thank you.
Some of us are used to like, that's a 25 gauge.
The gauge. Yeah, so this is a 36 gauge. So very fine. So like with gauges, the higher the number, the finer it is. So yeah, 2 of these are 36 gauge. I think this is a 34 gauge. So super, super fine. But you can use thicker needles as well. And I do use thicker needles sometimes.
What is the-
In China, they use thicker needles.
What gauge would be better?
Let me see, I have this chart up here because I usually do it in terms of millimeters. That's how we usually measure it, the millimeter diameter. So let's see, I've used like 0.40 millimeter, which would be 26 gauge. I've also used 0.50 millimeters, which would be 22 gauge. That's thick, pretty thick for acupuncture. Even still, it's like not that thick in the scheme of things, but for acupuncture, it's thick. So also, one thing to keep in mind is that back in 200, the year 200 or the year 500 BC, the technology was not what it was today. So we can imagine like these are very, very sharp, really nice needles. They're not the nicest. They're actually the quality of this Korean company has declined a bit. I'm switching over to another company, but very, very sharp. The sharper a needle is, the less you feel it. Actually, you want it to be sharp, right? The duller it is, the more painful it is. So we want it to be sharp.
Are dry needles similar?
Similar, yeah. They usually use different brands, but they're similar. They might use a little bit thicker ones. And so I use thicker ones. Some needles are silicone coated. These needles are silicone coated so that they slide in and out more easily. So coated in silicone. I sometimes use uncoated if I want to be a little rougher. Sometimes we want to be rougher with the needling. So there's certain techniques that we actually, because the silicone, we usually want to avoid, like when we're removing it, for example, the skin can grasp the needle sometimes if it's uncoated. But sometimes I want that to happen because that's a particular needling technique with the grasping or tenting technique. But yeah, these are uncoated. This is what I use most of the time. Sometimes with the uncoated, they're too smooth. So we want there to be some amount of resistance or some amount of stimulation, some amount of play that we can do. So, we want the needles to be a good balance of like where you don't feel it so much, but you feel it also. And so, sometimes I'll use these really beautiful, thick, but very smooth needles where it's like, you just get such a strong chi sensation. Sometimes I'll use those, but these ones are a pretty good one. And so then some of the needles that you saw in the example are for draining pus and bloodletting, be more sword shaped. So because I do bloodletting as well sometimes. So I'll use this as an example of what's called traditionally the 3-edge needle. The 3-edge needle. So this is like it's hard to see in the video, but the kind of beveled edge. This is a modern example of the 3-edge needle or sword needle for bleeding. It's very, very sharp, works so well for bloodletting. I'll explain bloodletting in a second. Yeah. I might do a whole class on bloodletting because I'm a big fan.
Where do you do this?
Yeah.
Know your background.
Where do I practice?
Are you practicing?
In Alpine right now. I've just been in Utah for 2 weeks, so just practice. Yeah, I moved here from Boise. It's all my clinic in Boise. You can see a little closer. This is a needle for bloodletting, hypodermic needle. This one is hollow actually because it's used for injections and for withdrawing blood. This would be a very thin hypodermic, on the thinner side for hypodermic, but still, yeah. So yeah, that's this. This is a hypodermic for bloodletting, and so this is for bleeding veins. All right, so bloodletting is amazing. So for like sciatica, for example, asking about sciatica, bloodletting can be commonly done. So sometimes, and so when we're bleeding, usually with this, we're bleeding spider veins. Spider veins. Yeah. So exactly. So, yeah, I would be happy to. So like, there's a distinction between varicose veins and spider veins, right? So varicose veins are the bulging ones. Spider veins are the dark ones that are not raised. Sometimes they can be a little bit raised, but usually not raised. They can be purple. They can be even sometimes almost black or red. Those are spider veins. Often if we inspect an area around varicose veins, there might be spider veins nearby. So we don't bleed varicose veins because it doesn't fix the problem. For varicose vein, it's more of a symptom than anything. But for varicose veins, we would treat with something internal. We need to get the circulation back to normal with internally. But the spider veins we would bleed. So spider veins are always a sign in Chinese medicine, a sign of blood stasis. So this is spider veins, in a way, it's not really blood because blood is what is circulating in the circulatory system, circulating in the arteries and the veins and the capillaries. This is not blood that's in the circulation anymore. it's deoxygenated blood that's basically sitting there. And so it's blood stasis. So we actually want to remove that. And so and we see a lot like people who, have like DVT, right? Deep vein thrombosis, which is a blood clot from the legs that can travel up to the lungs, cause pulmonary embolism. Right, so that's a blood stasis condition usually. So that person probably has spider veins probably before. And if we release those, we could prevent actually, DVT or prevent stroke, or there are or heart attack, many different things that can be result of this blood stasis, crappy blood, like blood that's not circulating well in the system. And so we want to release that. And then when we release that, it decongests the area and allows the normal blood to flow better. It's almost like congestion, like a traffic congestion. So bloodletting is very effective, but we generally will bleed actual spider veins, like the actual blood stasis itself. And so for sciatica, sometimes if someone has sciatica, I'll inspect the back of the knee. There's an acupuncture point here, which is the most commonly bled point in the body. Here, but we'll inspect the general area, like around here. And if there's spider veins there, dark spider veins, we can release that. That will immediately decongest the whole nerve pathway. Remarkable, like bloodletting is very immediate, really immediately effective.
And then will the spider vein disappear so you won't see it anymore?
The spider vein will fade away. Even we can see, like I mentioned with varicose veins, a lot of times with varicose veins nearby are spider veins. And when we bleed those spider veins, the varicose vein will actually shrink. Might not disappear completely, but we'll see immediately it will shrink because all of a sudden the blood can flow more normally again. Spider veins not painful usually, no. Varicose veins can be.
Is there a reason why women have spider veins versus men?
Yeah, it's a good question. Well, so from a Chinese medicine perspective, women are more governed by blood, men are more governed by qi, right? So women have this relationship with blood, right? They have a menstrual cycle, they bleed monthly. So, the menstrual cycle becomes very important, right? For diagnosing conditions of the blood, right? So like if we look at the menstrual cycle and there's clots, a lot of blood clots, that's a blood stasis condition, right? It's better out than in, right? We want the clots to release, but it's a sign that there's an issue. There's a blood stasis condition, and so if someone had blood stasis condition, woman like a lot of clots in their period, we want to resolve that. We could take herbs to treat the blood stasis, or acupuncture to resolve the blood stasis. Question.
So bloodletting, is that the same as wet cupping, or those are
Wet cupping is a bleeding technique. Yeah. So when we're talking, I could talk about bloodletting all day. I will teach a class on it. I would like to. We'll get back on track in a second, but bloodletting is kind of a part of acupuncture. But with bloodletting, we can be talking about bleeding veins, right? Which is usually at legs, sometimes arms, but usually legs. Spider veins, we could be talking about bleed the ear sometimes, or bleed points like the fingertips. So for that, like we can use for bleeding fingertips or bleeding the ear. There's different effects of why we would do that. We would use like a lancet, like a diabetic lancet, like this, very thin, because all we need to do is puncture a hole enough for the blood to come out, right? Where there's a lot of capillary circulation, this is all we need. But if we're bleeding a spider vein, this would not be sufficient because it doesn't create a big enough hole to allow the blood to release. So, it's not effective and could actually be harmful because you could be puncturing that spider vein, but not a big enough hole to open up, and so you could cause a hematoma or a little bruising. Not a big deal, but so for bleeding veins, we use the 3-edge needle here, the 3-edge needle, which I showed on the video screen. For bleeding the ear or fingertips or points, we use the lancet, and then there's this other amazing tool called the safety lancet for wet cupping. So for wet cupping is cupping, but with blood involved. And so basically we do a few punctures, and then do the cup, and then some blood comes out. And when we talk about bloodletting, like we have a certain association with this word bloodletting because like medieval times with leeches and people like draining out a lot of blood. When we're doing these bloodletting techniques, it's actually very minimal blood that's coming out. And usually we just want to clear out the blood stasis. When the blood starts coming out normally after that, we don't need to bleed anymore. There are some clinics in China that do like pretty, intense bloodletting, but you don't need to do that. Anyway, so with the safety lancet is nice because it's nice and thick, but relatively painless. So we can do a few of these and then, and then cup the area. So for wet cupping, we do usually more so on the back, where the other techniques wouldn't really work. So wet cupping also miraculous. So, with wet cupping, sometimes we'll see actual blood clots come out with wet cupping, actual blood clots come out. So just like one little case study, I'll just say like one, short case study of bloodletting for frozen shoulder, like a person who had frozen shoulder, a lot of signs of blood stasis, which we can diagnose. Chinese medicine diagnostic system, see blood stasis, and I did a wet cupping here, and out of it comes a thick clot, right? So there can be microclots, right, in the blood, microclots, and then so these congealed, almost looks like a slug. Actually, you can pick it up. You can literally pick it up. Sometimes we see that, this congealed blood. And then so when we release that blood stasis, all of the blood can flow normally. And then so like this was a patient who couldn't move their shoulder at all. And then all of a sudden they can move it completely. It's like, thank you for coming. Oh, online. Yeah, we can get it later. Yeah, we can get it later. So anyway, that's a little bloodletting side note. We're doing well in time though, so we can have this little diversion, but big topic, controversial one, but big fan of bloodletting. Something that is not really painful. It's not really painful. Bloodletting, not so much. Yeah. Yeah. So it depends. It depends. So like in general, from a Chinese medicine perspective, when we do bloodletting, we want is for relieving blood stasis or for removing stagnant blood. So to normalize the blood circulation, release any stagnant blood, as well as to clear excess heat or inflammation. So certain spots we can clear inflammation systemically based on an acupuncture channel perspective. For example, there is a point here, right, between the C7 and C1 vertebrae here, where a lot of acupuncture channels run through that area, or a lot of nerve pathways run through that area. That point has an effect of releasing excess yang or releasing excess heat. So we can do a wet cupping here and release inflammation or stagnation from many different channels. So my teacher in Taiwan, anyone who had an autoimmune condition or a lot of excess heat or inflammation would do wet cupping here. So the effect is going to depend a little bit on the point or the area that we do. And then for bleeding the ear, that's a big topic. I kind of can't get into it, but we can talk about it in the bloodletting because the ear, that's like a whole thing in and of itself, auricular acupuncture. Okay, so that's a little bit about the 9 needles and kind of the modern interpretation. And some of these techniques, like with the 9 needles, we have like this one that looks almost like a spoon. It's like almost like a combing one. So that one we can replace with the gua sha or with a tool that's the scraping. So many of these techniques we can replace with other instruments, even though we don't use the 9 needles so much anymore, the classical 9 needles. Okay. Any questions so far? Oh, she's going to join right now. Yeah, if you send me her email, I can send it to her. Any questions so far? Sure. We'll get there. We will get there soon. I promise. That's like the next thing. Mm-hmm. That's a very good question. So how long we leave the needles in is going to depend on what we're doing, depend on the exact technique or the goal or the tradition of acupuncture that we're practicing. But in general, we leave the needles in 25 to 30 minutes.
Do acupuncturists specialize
Yeah, good question as well. Yeah, so they do. Yeah, the short answer is yes. And so we can talk about Chinese medicine as a whole because we have herbal medicine, right? And we have acupuncture. Those are the 2 most popular branches right now of Chinese medicine. And so, you can be an herbalist, for example, that specializes in particular things. You can be an acupuncturist that specializes in particular things. Many are both acupuncturists and herbalists. I'm an acupuncturist and an herbalist. And for me, as an acupuncturist, if you're just an acupuncturist, you can say, well, I can treat everything with just acupuncture. Or an herbalist, you can treat everything with just herbs. But that because they're a complete system in and of themselves. But however, there are certain conditions that, like, for example, in China, in the hospitals, are like go-to things for acupuncture. And those are usually things that Western medicine can't treat well. So for example, stroke rehabilitation, very popular in China, stroke rehabilitation, right? Because we want to retrain the nerves, right? It's an issue, it's an issue of the nerves and of circulation, right? And so, you know, other than physical therapy, occupational therapy, there's not a lot that Western medicine can offer, you know, or maybe, you know, maybe blood thinner to prevent any kind of clots, but otherwise, you know, so that's something like acupuncture would be used for that. A lot of pain conditions, right? Acute or chronic pain. That's what acupuncture is used like as first line for in China, would be those things. And then herbal medicine similarly. You know, for example, another thing like dermatology, like there's certain areas of Western medicine that from my perspective are not as developed as other areas, right? Like dermatology as a field is kind of like on a cosmetic side is really pretty developed, you know, plastic surgery perspective side, and, you know, cosmetics and things like that. But, you know, for most dermatological conditions, eczema, psoriasis, psoriatic arthritis, these things is pretty primitive. Like the only treatment that they have is topical corticosteroids, basically. That's basically what they do. And like to the extent that like there's a joke in med school, like people going through med school, that because they have to go through their rotations, right? And they're like, oh, derm, put a steroid on it. That's like the joke, because it's like that's what they do for everything, right? And anyone who's had a skin condition, you're like, this is really all you have. Like that's all they do. You know, so whereas like a skin condition, you know, from an internal medicine perspective, is never just a skin condition. It's never just an issue of the skin. There's always something going on internally that's expressing itself in the skin. So just putting a topical corticosteroid is never really, usually is not really that effective, even for just the skin condition. But anyway, so acupuncture for complicated skin conditions, in my experience, not that effective, but herbal medicine can be really effective. But dermatology would be a specialization within Chinese medicine. I don't specialize in dermatology, so I actually refer difficult dermatology cases for a couple of other practitioners who are specialists, because it's like a whole specialty within and of itself, a whole tradition of what they do, yeah, for dermatology. So yeah, OBGYN specialty. So in Chinese medicine history, there were these specializations. So they would be seen as like total, you know, specific disciplines. People would, you know, specialize in medical school in these different, you know, areas. And so they have their own, you know, their own herbs that they're used, their own styles, their own formulas, all of that. So yeah, there are specializations for sure. And for me, I kind of like, I want to specialize again in things that Western medicine doesn't do well. Like I'm not going to like go out and treat polio because there's like a, you know, there's a vaccine that's already treating polio, right? But, you know, I'll specialize in treating, you know, neuropathy, peripheral neuropathy and fertility and things like that, chronic pain that are very debilitating and that there's not a lot of good answers for, that acupuncture helps a lot with. Okay, so now we're going to get into a little bit about different styles of acupuncture, different traditions, one of which is dry needling. So I'm going to write a few on the board. So these are different styles or different traditions, and we're not going to go into detail about all of these. So one of them is what's called TCM, or traditional Chinese medicine, So this was a system that was developed between the 50s and 70s in China. So, you know, Chairman Mao, he originally outlawed Chinese medicine, outlawed the practice of Chinese medicine because it represented everything that was old, everything that was backwards, everything that was superstitious, right? So the goal of first you know, the Republic of China, which was, you know, China was a dynasty for many years, right? Imperial system, right? With an emperor, and then eventually became a republic, right? In the late 19th, early 20th century. And during that period, acupuncture was not popular at all. And Chinese medicine wasn't that popular because, again, they were wanting to modernize. They wanted to get rid of everything that was old-fashioned. How's it going? So during that time, Chinese medicine was not outlawed, but it was not popular at the start of the 20th century. And then as we come into the communist time, after the Communist Revolution, Mao takes over in China, Chinese medicine was actually outlawed. It was made illegal because, again, it represented everything that was old, backwards, and they wanted to go into the modern era, materialist, right? Communism is all about materialism. Material conditions dictate our reality. So they wanted to get rid of everything that was old and superstitious and all of that. However, sometime after that, huge public health crisis in China, Mao personally uses, he is reluctant, but he winds up being prescribed Chinese medicine to treat ruptured appendix, and he recovers completely with Chinese medicine. So then he has a personal change of faith, change of heart, and then as well, they're amidst a public health crisis, and so he decides to reinstitute Chinese medicine. Okay, now it's popular, but now it's allowed, but now we want to establish committees and make it scientific and make it systematized. Thousands of years of diverse traditions, all these different ways of doing things. He wanted to make it more scientific and more standardized. So that's what we call TCM, or traditional Chinese medicine. This was born out of communist committees in China that went through these thousands of years of diverse traditions in order to make things easy to understand, easy to accept, and more materialist and scientific. So that's what we call TCM. So that's the majority of what is taught in the world today, is what comes out is like a tradition, quote unquote tradition, that's like 50 to 70 years old, TCM. Okay, so this was first introduced into the United States in the early 1970s. So up until that point, no American leader, no American president had been in China until Richard Nixon in 1971 finally goes into China. A very big deal. So he goes into China with a small press corps. One of them among them, James Reston from the New York Times, got appendicitis while he was in China. So he had to have surgery. And then while he was in the hospital, the second day after surgery, he was having intense stomach pain, very intense stomach pain. And so the doctor came in and they put some needles in his leg. They did acupuncture. He didn't know what was going on. And they did acupuncture. Then he describes this whole experience in the New York Times in 1971. Yeah, 1971. He recounts this experience in China. So basically, he had this intense stomach pain. He had one acupuncture treatment. He was cured afterwards, and then he wrote about it. And that was, most Americans' first exposure to the system of acupuncture. Even though, what's that? James Reston from the New York Times. Yeah. And then they also, when they were touring the hospitals, they saw people getting acupuncture for anesthesia. So again, so that was another fascination. What is this? They have needles in their head and in their arms, and they're getting cut open, and they're like talking, and everything's fine. So that was the first exposure for most Americans, with acupuncture. Although acupuncture was already being practiced in the United States, but more on the periphery, right? In Chinatowns and cities, like it was already being practiced within, East Asian communities. But for most Americans, they had no idea what this was. And there's the history of acupuncture in the United States is really complicated and really interesting. But that was the first introduction for most people. Okay, we're just going to kind of mention these systems to just give a constellation of several different styles that are popular today. So we have 5 elements. So 5 elements acupuncture. So when I say 5 element, we're talking about what's called classical 5 element acupuncture, which is a system which was systematized by J.R. Worsley, a British osteopath in the 1960s to 70s. Okay, so this was a system that's also new. Although all of these systems, like I'm saying, this is new. They're not totally new. They're just a new systemization, a new tradition out of the historical basis of acupuncture and Chinese medicine. So this guy J.R. Worsley. So this is another really popular system. So people who study 5 element acupuncture, they'll say, oh, 5 element versus TCM. Like that's like they're contrasting themselves with TCM. In reality, there's so many other traditions as well, but in their mind, they're like, oh, TCM is like a misrepresentation of classical Chinese medicine. 5 element is really more authentic. But ironically, this was made by a Westerner, actually, not by a Chinese guy. So J.R. Worsley, so my school that I went to was a 5-element acupuncture school in the J.R. Worsley lineage. J.R. Worsley, interesting guy, kind of like a shaman, actually like a shamanistic person who had a really healing presence. He healed a lot of people in his presence, very charismatic person, had like a cult of personality behind him. But he was also very not Chinese in the sense that he did not reveal his teachers, which is a big no-no from a Chinese medicine, from a Chinese perspective, right? Or East Asian perspective, because everything is all about the lineage, right? Like it's all about who are your teachers. That's the only thing that matters. And so he, had his own ego. He was making his own system, and he never credited his teachers. He studied from Vietnamese teachers and Taiwanese teachers. At the time, China was not open, so he studied from other places, but he never talked about his teachers. So that's J.R. Worsley. So that's that 5-element tradition. In general, 5-element is more focused on the spiritual and emotional causes of illness, more so than the physical. And then we have like Japanese style, which is so general, Japanese style. And I don't really know a lot about Japanese style. I'm more on the Chinese side. But Japanese acupuncture is more frequently characterized by very gentle needle technique and a lot of moxibustion. Moxibustion is the burning of this herb mugwort on the skin. You have lots of moxa. Superficial gentle needling. Then we have master tongue acupuncture. And so when I'm introducing these different traditions or these different styles of acupuncture, to kind of just give you guys an idea of the vastness of the practice of acupuncture. So each of these different styles of acupuncture the experience would be very different. The experience of receiving acupuncture would be very different from the intake procedure, what the conversation is like, what they care about diagnostically, where they do needles, how they needle you. It will be very different experience. So, TCM, they might do like a lot of electroacupuncture. This is a new system, so a lot of electroacupuncture. Whoops. A lot of electroacupuncture. They do strong stimulation generally. They generally do a lot of needles. 5-element will do a few needles, gentle needling. Also kind of a lot of moxa. They do a lot of emotional processing. It's almost like more like a therapy session sometimes. Japanese, they do a lot of moxibustion, gentle needling, a lot of feeling of the pulse. Master Dung acupuncture is an interesting one because they have all their own points. They're all their own acupuncture points. They have some of the same points, but they have also their own unique points. So the Master Dung, I'll kind of like put a star next to ones that I've studied. So Master Dung, 5-element, TCM. So Master Dung acupuncture is characterized by they do a lot of points on the fingers, hands, feet, which are very neuroactive areas, right? So a lot of nerve endings there, sensitive points, communicate readily with the brain, very effective, very powerful points. Master Dung acupuncture also very interesting because in a way we can say you're treating internal condition. Are you treating internal condition, or are you treating more of a channel condition? Or we can say, I would say channel condition. This is pain, basically. So, we can divide syndromes into something that's going on internally with the organs, the body's not functioning well, the organs, the substances, etc., or something just like a more superficial, in a way, more of a pain condition, a channel condition. So, but if we're treating from a Master Dung perspective, if we're treating a channel condition or pain, they would never needle where the pain is. Never needle where the pain is. So this is characterized by what we call distal acupuncture. And so they use a lot of these kind of mirroring techniques, or these kind of the body as a hologram. And so you needle these other parts of the body to treat, for low back pain, they might needle only points on the hand. Right? Or for pain on the knee, they'll needle points on the on the opposite elbow, for example. So they have all these things mapped out through the different channel relationships, acupuncture channel relationships.
So who is Master Tang and like what?
Yeah, that's interesting guy. So Master Dong was a Taiwanese guy who well, he only became Taiwanese because of the Civil War. So basically, Civil War took place in China between the nationalists and the communists, right? The communists ultimately won. He was on the side of the nationalists, and so he was a acupuncturist for the army, the actual guy who we call Master Dong, but he comes from a family lineage. So very common that there's family lineages in China. So basically where the whole system is taught from the father to the eldest son and so on. So we don't know exactly how old, but Master Dong scholars think that probably pretty old, perhaps 2,000 years old, but at least 1,000 years old, the Master Dong lineage. And so Master Dong, when the nationalists lost, he and the rest of the nationalists retreated to Taiwan, took over the island nation of Taiwan, and that became the Republic of China. And so then he became a physician, a doctor in the Republic of China. He didn't actually have a medical license. He was practicing without a license. He ultimately his practice was shut down actually because they were standardizing things and he didn't have a license. But he finally, during that time, things had changed so much, he decided to take on students. So he wound up teaching. He had probably like maybe 30 students that he taught, who would be the next generation. And then so they've taught. So this was kind of like he was, I think he died in the 70s, early 70s. So anyway, that's Master Dong, some amazing Master Dong teachers. And it's a really, really beautiful lineage. So the characteristics again of the Master Dong system, did a lot of distal acupuncture for pain. For internal conditions, they'll always treat the affected organs. So it's like if you have a heart problem, they'll go and treat the gallbladder meridian, and it's like they're understanding the connections between the different organs in a very, very interesting, very unique way. It's almost like one person described it as like a Confucian way, where like if you have a problem with someone, you don't go to them directly, you go to like their grandmother or their uncle or like the person who can influence them. So in a way, that's what they do on a channel perspective, that they don't go to where the disease is, they go to where they can treat it. Anyway, so that's Master Dong. Kind of like foot zone, yeah. So foot zoning, or is an example, is a different system. I can probably talk more about where that comes from. But in Chinese medicine, there is this idea of, again, the microcosm and the macrocosm, right? Just as human beings are a reflection of nature as a whole, we can zoom in to different parts of the body that are a reflection of the whole. Right. So kind of like human beings, like a fractal, right? If we look on a cellular level, that's like a human being as well. We're looking all the way in, right? There's a membrane, there's the internal organ, and so on. But then as we zoom out, the human being as a whole organism, and we can zoom into certain parts. For example, the whole face can treat the whole body, the whole foot can treat the whole body, the hand can treat the whole body, the ear microcosm for the whole body. So there's these different microsystems in Chinese medicine, and they're, actually we can even put as a whole tradition auricular acupuncture, ear acupuncture. This was very popular in Vietnam, and then in turn in France. France is one of the early pioneers in the West of study of acupuncture through the Vietnam connection, through the colonization of Vietnam. So they saw acupuncture in Vietnam, they brought it back to France and did a lot of research. One of the things they did a lot of research on is auricular acupuncture. And so a lot of interesting research showing all these neuroactive areas in the ear. When you stimulate this point in the ear, what happens in the brain and so on. So auricular is one microsystem. But then we can say also Korean hand acupuncture. That's a whole system where they treat the whole body through the hand. So they image the body onto the hand and treat that. So if you have low back pain, they'll go to the low back point on the hand and find that be very painful, and then they'll needle that and some other points. So that's Korean hand acupuncture. What else do we have? Yeah. And then we could say what we might call like orthopedic acupuncture. And this is where we can get into dry needling. I wasn't looking how to spell needling, I was just looking at what time it was. Dry needling, motor point acupuncture. trigger points. Okay, so dry needling. The interesting terminology, but the terminology has a reason for it. Basically, starting in the early 1940s, doctors were starting to do some injections into these myofascial trigger points. Trigger points being these very irritated spots in the muscle, right? When you press it, pain, that's a trigger point. So these hyper irritable spots in the muscles. So doctors were finding that they, basically by accident, because when they were, injecting, saline solution or whatever, they were finding that it was helping with pain in those areas. So wherever it started, they started basically injecting various substances in trigger points, in irritated spots. Things like corticosteroids, analgesics, or even then saline solution, just saline solution. They're finding that by injecting these substances, they were relieving pain. And so this was Dr. Janet Travell was one of the main researchers in this kind of therapy, as well as David Simons in the early 1940s. They were injecting these substances. And then in 1979, there was a study by a Czech physician, Karol Lewitt, where he basically was showing that it was actually the needling effect, distinct from the injecting substance, the actual substances that's injected, or the wet needling, right? So he was distinguishing between wet needling, where they're injecting some kind of substance, and dry needling, where they're not injecting anything. So he presented this large study that showed that actually dry needling, even without any substance, provides the same effect as wet needling. So since then, there's been a lot of studies that have found no difference between injections of different substances and dry needling in the treatment of musculoskeletal pain. So that's where the dry needling thing comes from. And so then from the 80s onward, we had, it's taken a while to get more of a wide audience, but where we have dry needling. And so dry needling is basically trigger point needle. It's kind of basically the same thing. They're basically the same thing, where we go into these trigger points, or these painful bands in the muscle, and there's common trigger points that are, like accepted, but a trigger point is basically anywhere we find a painful spot in the muscle. What we call in Chinese, asha point, pain point. In Chinese, asha means yes. So it's basically yes. That's the asha point. That's asha point. So that's the trigger point. But asha needling, so it's like, in a way, trigger point needling is new, but in a way it's not new at all, because asha needling is very, very old, needling where the pain is. It's kind of like usually just one part of the constellation of a treatment. It's not really a comprehensive treatment in and of itself to just, oh, it hurts here, let me needle it there. That can help, but we actually want to understand, systemically what's happening in that channel, what's happening internally that's giving rise to that. So we kind of like ideally want to have a more holistic or comprehensive approach. But dry needling or asha needling can be very effective, as an ingredient in a comprehensive treatment. So I have no problem with dry needling or trigger point needling. I just like it to be more comprehensive, ideally, or and to have the proper training, right? So dry needling, a physical therapist or a chiropractor will have a 2-weekend training, and then they're certified in dry needling. So then they have an advantage then against the competition, because they can then offer dry needling as a add-on modality, and bill for it, etc. And so everyone wants to stand out from the crowd. Dry needling is one way that physical therapists and chiropractors can stand out, and it's effective, and it's very effective. So yeah, any other questions about dry needling, because that was something you guys were curious about?
I just did it Sunday.
On
this.
How was that?
It's great.
Nice.
I couldn't even feel it.
Yeah. Oh, okay. Nice.
Yeah.
Yeah, it's great. I do it. I like it. Yeah, it can be really helpful.
So yeah, I have a question. So is regular just acupuncture? It's just acupuncture. It's not wet needling versus dry needling.
Right. Yeah, it's its own. Yeah, exactly. And so it's like, I mean, it's more like dry needling. If we're comparing wet needling to dry needling, it's more like dry needling. But basically dry needling is like where they only will go into where sometimes they'll go like, some muscles nearby or something like that, or they'll go and find and press and see where you have pain, and then do an aggressive needling. That's dry needling. Acupuncture includes that, but is like broader, because you can use acupuncture for internal conditions and acupuncture for this and that. And like I'm saying, these are all other styles of acupuncture. So yeah, dry needling can kind of fit within acupuncture as a whole, but acupuncture itself is not just dry needling.
So is dry needling, is it always treating in the point of pain?
Basically,
Okay.
yeah. I mean, a more sophisticated, person would maybe see, okay, there's a pattern, and so let me look at these other muscles that are related and find those trigger points and needle it. But yeah, commonly it's like it hurts here. Let me do it.
Mentioned this earlier, but isn't it partly to release stuck fascia?
Yes.
And so whenever all the fascia is connected.
Yeah.
So
Yeah,
if it's
so-
pulling in one place,
right.
it's gonna be pulling somewhere
Exactly.
else.
So these, and especially these trigger points, a lot of these trigger points are on areas where multiple fascial planes will overlap. And so when we're releasing that trigger point, you're releasing like all of those connective tissue
So
planes.
tell me if I'm understanding this
Mhm.
correctly. So regular acupuncture is not addressing specifically like releasing fascia. And I mean,
Yeah.
not that it
Yeah.
can't release some,
Yeah.
but
Dry
it's-
needling is specifically,
dry
basically, that's what
needling
it does.
specifically towards
Yeah.
releasing fascia.
But dry needling, that releasing those kind of things is also a technique in acupuncture, if that makes sense. But acupuncture doesn't just do that.
Yeah, but acupuncture seems like it has the focus more on finding the pathways of energy and addressing things through that.
Yes and no.
will Also, like,
Yeah,
I don't wanna say
because
inadvertently, but like.
yeah, I know
not
what you're saying. Well, I think that's how dry needlers portray it, that like, oh, acupuncture does this other thing, which is energetic, and we do this thing.
Okay.
Whereas, and that is sometimes true.
Not
That is
this
sometimes,
isn't energetic. I would
No,
consider it
yeah.
also energetic, but it can feel a little bit more like it's just about the
Right.
gross physical plane.
Right.
Rather than energetic plane.
yeah. And I
as
think a lot of times
focus.
acupuncturist focus is different. Like they're not as focused on that. But then there are other acupuncturists, like licensed acupuncturists who do a lot of, specialize in orthopedic and do a lot of these techniques that they do think in those terms specifically as well. But they might also do other things.
Yeah.
So yeah,
So there's a lot of overlap.
a lot of overlap, but there are kind of different agendas in a way.
Yeah.
Yeah.
One thought I was thinking is like the nervous system is acupuncture,
Mhm.
whereas dry needle is
The muscles. Yeah.
And then if you're saying they're orthopedic ones, they're more skeletons.
Yeah. 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 So the
And
ortho.
of course, if they're all connected, then they all
Right,
relate.
they're all-
but there's some
Yeah.
overlap.
And then there's motor point. I actually might even do a demo of this motor point if we have time, because it's pretty interesting, because we that's what, we've done that and talked about that
Do you have to be a physical therapist or a chiropractor?
to do dry needling. Yeah. Yeah. Or a doctor, MD. They all have like
So
these
I
kind of,
can't go.
no, I don't think so. I don't think massage therapists can, I don't think so. Every state is a little different, so, but I don't think so. Cover a lot of ground here. Okay. I'll mention this too. So this could be seen as its own system in a way, but it's kind of interesting from an energetic perspective. I think it's kind of profound to look at. So we'll look at these 5 channel systems of acupuncture. 5 channel systems. So last week in the Taoism class, I talked about my Taoist teacher, Jeffrey Yuen. He's also not just a Taoist priest, but he's a doctor. And so he popularized emphasizing the 5 channel systems of acupuncture. Okay, so now we're going to get energetic. We're going to talk about energy in a general sense. So in a way, and I think we even mentioned this last week, we have 3 levels of energetics. Okay, and like we talked about last week, the number 3 is very important in Chinese cosmology and Chinese thinking. So we have, like, in a way we could look at heaven, man, earth, heaven, human, earth, or we could look at it in terms of Wei, Yin, Yuan. So when Wei was basically the defensive, if we're looking at qi, right? Defensive qi. Yin is what's called the nutritive. This is just a direct translation of these terms. Nutritive level. and the UN is the source level or the deep level. Okay, so 3 levels of energetics. So
Like Jing, Qi, and Shen.
yeah, like Jing, Qi, and Shen as well. So we could put Jing, Qi, and Shen as well when we're looking at it like that. So when we have these 3 levels of energetics, we're kind of dividing the Qi in the body in 3. Okay, and so what we talk about most commonly is what's called the primary channels. Primary channels. And these are the channels that are loosely associated with the organ system. So like we mentioned, like the heart, right, the liver, etc. The primary channels that have a loose but not direct relationship with the organs themselves. And so the primary channels are mostly acting on this yin level. I haven't really said what this is, but this yin level or this nutritive level, which basically is mostly what flows in the blood vessel. This relates in terms of substances. This relates a lot to blood, qi. Basically, with circuit. So if we look at the qi of the body as like a river, as like a waterway system, right? This was a common way that qi or energy is visualized in the body as a waterway system. These would be the rivers, right? Like the blood circulation, the rivers, the circulatory system as an example of those rivers. This would be like the deep reservoir, the UN level. The Wei level would be like the wells at the surface. Okay, so we could also look at like this as like the immune system, right? The way the immune system where we meet the world, the exterior. So just
you said that Yuan was more of a
deep,
like
yeah,
pond or reservoir.
yeah, deep. This is a deep reservoir or sea or ocean kind of level. Yeah. So we look at the primary channels. That's mostly at this yin or nutritive level. However, it can sort of access a little bit of each. So most acupuncturists are using this primary channel system only, basically only using the primary channel system. But there's different channel systems that correspond or affect more directly these other levels of energy. Okay, so the UN level, this would be what are called the 8 extraordinary vessels, or 8 extraordinary vessels. So this is a channel system that in Chinese history was, for the most part, not really used until the Ming Dynasty in the 1500s, when there was a different philosophical orientation, where now people were wanting to more directly think about their destiny, or think about themselves in an introspective way, or think about altering their genetic expression in a way. So so we can think of kind of like this is like a level of like a DNA level, this deep level. So throughout much of Chinese history, it's like, well, that's just what we're given, our DNA. We can't really alter that. So we don't really think about that much. But then it started to become very popular. Dr. Li Shizhen started to outline how to treat the 8 extraordinary vessels, to work on these very deep issues. So if we think about 8 extraordinary vessels, we might think about congenital issues like deep ancestral trauma, getting that from an emotional level, or ancestral medical conditions, etc. So and more like deep disposition, affecting kind of the genetic expression, right? So that's 8 extraordinary vessels. And then at the Wei level, we have what's called the sinew channels. Again, this is more superficial level. So this would be, the sinew channel is used a lot more to treat musculoskeletal, or MSK, we can put it musculoskeletal. Not only that, because we can also, if we're thinking about this Wei level or this defensive qi, we can also use it to treat any kind of defensive or immune system issues. We can use it to treat allergies, any kind of like hypersensitivity to the exterior. That's a Wei level issue. So we can use the sinew channels to treat that. And so the needling technique is going to be really different for treating these 3 different levels. Basically, superficial, moderate, and deep needling. So when we do the UN level, accessing deep level of energy, we needle deep. And we do different techniques, right? So this would be, as far as needling technique, this would be deep needling. And we do this vibrating technique. Vibrating technique, either vibrate the body or vibrate the needle. And so that's the resonance of what we want to do when we're doing the UN level. This is energy that moves very slowly. This is energy that moves very fast. This superficial level.
Do you practice all 3 of them?
There's 5, but so far 3. Yeah, so this 5-channel systems, the reason why I mentioned this guy, Jeffrey Yuan, my teacher, is because he popularized his conception of the 5-channel systems. And so he emphasizes, well, if you're an acupuncturist, you need to be familiar with all of these channel systems, not just the primary channel system, which most people use today. There's a reason why. There's a certain time in Chinese history where the primary channels became, the prized one, or they became the main thing that people focus on, because through the primary channels, there's different ways to access these different levels. But if it's a specific, UN levels issue, this would be more of resonance, this channel system. And when I say channel system, these are actually different channels, different meridians. There's overlap, but
The vibration that you did on my serratus anterior, is that what you're talking about, or is that?
that's motor point technique. That's kind of like, that's a different tradition. That's a modern technique. But we would be affecting the sinew. That would be a sinew release. If we do fit that into this system, that would be a sinew release, because we're treating the muscles, we're treating superficial, we're getting that muscle to activate and release. And so that would be a sinew level technique. And so the needling technique for sinew channel would be very different. It would be superficial needling. And so we use superficial, and we do techniques like chiseling, or tenting. Like I mentioned, we might use a rough, uncoated needle, twirl it so that the skin grasps it, and then pull it up, so create a tent. Painful, but effective. So those are sinew, superficial needling techniques for sinew. And so also it's like, with these kind of conditions, they will respond really quickly. For sinew, actual sinew channel problem, like 1 to 2 or 3 treatments would be resolved. This will be months of treatment. This would be like, we will want to do for like 3 to 6 months, because this energy moves very slow. Primary channels, we want to do like treatment twice a week for a month or 2, and then reassess. So these different levels, this energy moves differently. Okay, so those are 3 which have a direct association with these levels of energetics. We also have the low vessels, what are called the low vessels, or the network vessels. And basically, in Chinese we say the Jinglo. This means the channels and collaterals. Different Jing than the Jing Qishan. Channels and collaterals. So basically, the channels are the longitude, or the lines that go vertically, and then the low are what go horizontally. These kind of connect everything. These are the horizontal collaterals, or connective vessels. And so it's kind of like when you I think about it sometimes like when you open an orange, and there's like these all these little, the pith, the white pieces. Those are like the low, these all these network connections. And so those are the low vessels. This often will bleed. This is a bloodletting technique. So we do for the low vessels, we would generally do a bloodletting technique. So these are low vessels associated with the yin nutritive level. By the way, we could get more into this model and kind of analyze different things from this level of like emotions, like what is a Wei level emotional condition, Yin level emotional condition, UN level emotional condition, right? We can look at that, like more like we won't go there now, but we can use this system for differentiating. But when we identify, okay, this is a more Wei level condition, or Yin level, or UN, we can orient ourselves toward these different channel systems. And then we have the 5th one, which is kind of interesting. I'll do it over here, which is basically, it's called the divergent channels, which basically links the Wei and UN level. Divergent meridian, divergent channel. It's a very mysterious organ system, or channel system. So the divergent channels. So divergent channels, we see a lot of autoimmune conditions. And so because this, the autoimmune condition is something where it's like, yes, it's an immune system issue, but there's actually a very deep basis of it. The body's very deep yang qi or vitality is like leaking up, is activated, this inflammatory response where it all of a sudden is coming up to the surface. So that's this, autoimmune. We can just for one example of a divergent channel condition. And so the needling technique for a divergent channel meridian. Well, first of all, how we doing on time? Pretty well. We started a little late, so we can go a little late. But divergent channel, the needle technique would either be what's called DSD or SDS. So this is either deep superficial deep or superficial deep superficial. Okay. All right. So if we imagine someone is in an autoimmune flare. Okay, autoimmune, their inflammation's out of control. They're having whatever kind of, maybe think of rheumatoid arthritis or something, right? Like a lot of pain, a lot of inflammation. Their deep vitality is all of a sudden they're like fighting themselves. It's at the surface. So what we want to do in this case, we want to basically what we call promote latency. We want to put that pathogen back in latency. So we want to take this superficial pathogen, this inflammatory response, this pathogen, and we want to put it into latency. And so we would do deep, superficial, deep. So we would needle deep, stimulate, connect with the chi, needle superficial, or bring it up to the superficial level, make sure we still connect with the chi, and then we would go back deep again. And so this is to promote latency, because the body has all these mechanisms of keeping pathogens in latency, right? Just like with the spider veins, it's like actually the body is being wise because it's taking this stagnant blood and it's putting it over here, kind of like quarantining it, right? And so then we can like let it out of prison actually, but we let it out into the exterior by bleeding, not into the body, right? So the body has a lot of ways of promoting latency or putting pathogens in latency. And that's not necessarily a bad thing. So in this case, when someone is in an autoimmune flare, we actually want to promote latency. We want to bring that pathogen deeper into the body, even though that sounds bad, but the person doesn't have the resources probably to actually deal with that pathogen at the time. So generally with the divergent strategy, if someone is in an autoimmune flare or active inflammation, we will want to do DSD technique or deep superficial deep to bring that pathogen back in latency so their symptoms resolve. It's not curing the condition, but then we do that, and then maybe we build up the person's resources so that eventually we can do an SDS or bring it out, actually release that pathogen. So that's from a divergent channel perspective. If someone is doing well, they have an autoimmune condition, but they're doing well, no major problems. If we assess that their resources are good in terms of their chi, blood, fluids, etc., maybe we can do a SDS. We can actually bring that pathogen to release out to the surface. Anyway, so these are the different channel systems: divergent linking the Wei and Yuan level, sinew channel as the Wei level, primary and low on the Ying level, and then the 8 extra on the Yuan level. So, and like I said, this can be seen as its own tradition in and of itself, its own acupuncture tradition, even though those who practice it would say, no, it's just, you just need to know these to be an acupuncturist. But because the primary channels were mostly what was emphasized throughout history, this becomes like kind of a new, like a more of a new way to think about it, but it's not really new. That's a lot. That's a lot. Okay.
Can you share some examples of things that you've treated with the Yuan?
Yeah. I've used it more for deep, like emotional trauma, emotional issue. When I say trauma, that's like such a loaded term. I shouldn't use that term. But like things that basically kind of things that can't be explained through these other systems. So it's like, I wouldn't go there for any kind of it just because it's an emotional condition, right? Someone could have an emotional condition and I could treat it through the primary channels or low vessels or sinew channels. But for something that seems like either that is ancestral, like it's very, very old or very formative, or, something that's like almost like a life theme that is, that just, from my assessment is like, and something that aligns with a particular channel. Like if it's like someone is having a Renmai pathology, right? And there's all these symptoms associated with it. So one, we could just say, oh, you just match the pattern with the pattern here. But in general for UN level condition, it would be like, and anything that is, well, for one thing, like congenital or like a child with like failure to thrive. That would be an 8 extraordinary vessel condition. But yeah, other things also when it's like, also it can be like, and this is a little bit controversial, but it can be when everything is going well and someone just wants to do deeper work, because this is like more constitutional level, right, or deeper work. And so we can just do this for kind of self-development, or someone who's wanting to process deeper parts in themselves, look at their life story. And in a way, we could look at each of the 8 extraordinary vessels as having different spiritual significance. Like one may be relating more to how we receive nourishment in the world, that would be the Renmai. One relating more to how we take action in the world. One relating more to like how we see our own story in the world, right? So there's these, we got an emotional level, or a narrative level.
Like, I'm confused. Do you guys get that? How are you doing it?
Yeah, we're just needling. We're needling someone and then doing like a really strong stimulation, needling.
No, meaning how
Mhm.
if you're working on the ancestral thing,
This one?
do you know what you're working on? Which ancestral pattern? Or
Yes, yeah. So
how do
each
you
of those
figure that
channel systems have a different kind of theme or a different thing. So like this midline, for example, the Renmai that goes up the midline of the body. We can think about we could just kind of think about what that represents, the areas that it goes through. And so this is an area that relates a lot to nourishment, to the ability to receive nourishment, and to like the kind of very basic, like feminine quality of receptivity, right? So like the kind of, this is seen as like the primordial yin, whereas the spine is seen as the primordial yang, qi. So you think about the development of the child at first. So we say like a baby, they're actually mostly 8 extraordinary level at first. So like they're all Renmai at first, because they're all always like, right, all their energy is here. It's all about just taking in nourishment in order to survive, right? And then there's a certain point where the baby is able to raise up their head. That's the activation of the Dumai, the integrity of the spine. So it's the Renmai first, and then the Dumai. And if there's an issue with that, like let's say there's an infant, right? You're seeing an infant and they're very slow to actually raise, that could be a Dumai channel condition. We could treat the Dumai to actually activate that. But then we can see that later in life as well, as someone who has issues with the spine, for example, of like, very weak spine, osteoporosis, right, or rickets, or different things that could be seen as a Dumai issue. The integrity of the spine is not good. That's actually the primordial yang of the body. So we might treat that in that case. Or someone who has digestive issues their whole life that are not really either not responding to this level, or it's not really, and they have this like, deep issue of like, they can't receive nourishment in the world, etc. All these things that then we might treat the Renmai. And let's work with this, and then let's work on your ability to kind of take in nourishment. But we can work on that also from this level as well, because this is that's like, it's not like this is the only spiritual one. They're all could be spiritual, but yeah.
So did you learn all this in just 3 years of acupuncture school?
Actually, I didn't learn this in my program at all. Yeah, we didn't really cover this. I learned this from my teacher, Jeffrey Yuen. And so, so one of my mentors, Joselo Gutierrez, who I worked with for like 7 years, he studied from Jeffrey. So I learned a lot from him, but then I studied with Jeffrey directly as well. So that's where I learned it. And there's a really cool book, even if you don't know acupuncture, it's still a cool book. I can bring it out after the class. You guys can take a look at it, called Advanced Acupuncture, and Cecil Sturman, where it outlines in great detail all of these systems. Yeah, just go straight to advanced.
Skip.
That's what she calls it anyway.
What exactly is the 5 for these 5 channel systems? You didn't name 5 different systems.
We didn't get through all of them.
Yeah, there are 5. 1, 2, 3, 4, 5.
Oh, wait.
So sinew, primary, low, 8 extra, and divergent.
Oh.
Yeah, it's really kind of confusing. Which one? Divergent?
The loud, that's.
Luo is another.
Low is its own. Yeah,
Oh,
low is
it's
its
not
own.
part of the gate?
So yeah, it is part of the yin. Yeah, the yin has two.
Okay.
Yeah, the yin has two, and the divergent. No, in a way, all of them have two actually, because divergent is wei and yuan. So the divergent links these two. So they each have two systems associated with it. Wei has sinew and divergent. Yuan has 8 extra and divergent, and then yin has primary and low. So there could be practitioners who find themselves like they're a low practitioner, or they're a divergent practitioner, or they're a sinew person. They specialize in a way, specialize in that channel system, or specialize in that, you know, what that system represents, right? So maybe some people who are like so interested in like working with this really deep energy and like mystical, and you know, we want to alter your DNA and things like that. And then other people who are like really concerned with the, you know, the superficial level of energy, and they want to, you know, work at that level. And then, you know, other people who are more like day to day. I don't know. I mean, I've like gone through phases. Like when I learned the sinew channel, because when you learn, what Jeffrey recommends is like when you learn one system, try to treat everyone through that system. That's how you actually learn something, is try to do it on everyone. So when I learned the sinew channels, I was like, okay, I'm going to treat everyone with just the sinew channels. That was very nerve-wracking because I'm a Libra. I want to please everyone. I want to meet everyone where they are. I don't want to just offer one thing. What if they don't like it, right? But so, you know, that was a challenge, but I rose to the challenge at least for like a few days. And then but for a few days. So the first day back in the clinic, I had 22 patients, and I did on 22 of 22, I did sinew channel only. And which is weird because the sinew channel involves needling the jingwell points, or the points on the surface, all the finger points. And then it has this aggressive needling technique on the body. So it's like, I did that on everyone. And it was interesting. Yeah, some people got really good results, but I should have done that for like a month or two to actually collect enough data to see what it worked for, what it didn't. Because otherwise you sell yourself short. Otherwise you limit it to just treating acute musculoskeletal conditions. But you can actually treat everything through that. You can treat everything through this. You could treat a common cold through this if you wanted to. So yeah, for me, I would say like these the most. But you know, then when I learned divergent, I was doing a lot of divergent. Go through phases, but yeah, I'm more of like it. I don't know, do everything. I never have been like more like such a specialist in this way. But yeah,
Like extra tools.
Yeah, extra tools. And sometimes I get inspired and I'm like, oh, let me get into the sinew channels, and then I'm doing these aggressive needling techniques, and people are sweating, and it's a lot of fun. For me. Okay. Yeah, I'll just say a word about needling technique while we're on this subject, and then I'll do like one acupuncture demo at the end, like for the end of class. So as I mentioned, just with this 5 channel systems, there's different needling techniques for these different depths of needling: superficial, deep, moderate, and then different techniques associated with it, like the vibrating technique with the UN level, the tenting and chiseling techniques. And then we also have different needling techniques for there's many different needling techniques, but I'll just mention 2. So back to the first class of the yin yang, right? If we divide everything in 2, we want to treat someone, we want to either increase their yin or increase their yang. We can look at these 2 very basic needling techniques. That's called something like cooling heaven. And then like setting the mountain on fire. Okay, so this one we want to increase yang. This one we want to increase yin or cool yang. And so this is also more of a what we call a reducing technique. And this is what we call a more tonifying technique. or nourishing, tonifying or nourishing. And so if we let's start with this one, the setting the mountain on fire, this tonifying technique. So we want to kind of like mobilize the body's vitality to this particular point, or to, you know, everything that this point does or represents. So when we stimulate a point, we're engaging with the nature of that point and what it does and its functions and its, you know, its spirit, etc. But we also can be doing a specific thing based on how we're needling that point. So if we want to, for this technique, for tonifying technique, is basically where we want to, first we want to connect with the chi first at whatever level we want to treat. So let's say we want to, and again, if we're dividing into the 3 levels, superficial, moderate, and deep, let's say we want to bring deep yang chi to a deep level. So we would go to the deep level, connect with the chi. And when I say that, there's like a physical sensation, there's kind of like a grabbing, a little bit of a grabbing. You feel like some resistance. Like if it feels like you're going in and out of butter, you're not in the right place. So you can rely on the patient to say, like, let me know when you feel this. They might lie to you because they don't want to feel anything. But you know, like there is an actual sensation that they'll feel. Again, achiness, heaviness, tingling, sensation up and down, those kind of things. So we want them to feel it, but we can feel it as well when we're needling. So we can go down, and once we feel that gripping sensation, now we have some energy to work with. And then we want to do setting the mountain on fire. So we'll go up slowly, and then we go down strongly. And I'm doing it very dramatic. It's not necessarily, it can be very subtle actually. Like if you watch me do it, you might not even notice me doing anything. I could exaggerate it with my movements, but the actual movement is very little. But we come up and then we go down because we want to consolidate and bring and tonify. So the emphasis is on the down and in, tonifying, building, adding. So we do this 9 times. This is not accidental, but it's not that it doesn't matter that we do it 9 times per se. I mean, some could say it matters, but it's more of setting the intention because 9 is associated with yang chi, right? That 9 is a maximum yang and transformation. So we want to do it 9 times, but it's more important that you actually do the chi thing properly than do it 9 times. But if you want to, you know, set that intention, so then you go connect with the chi, you come up slow and then down, and then up slow and then down 9 times. And you do it until the person feels a very warm sensation. They should feel warm, setting the mountain on fire. So they feel warmth in that general area or other parts of their body. You could do it 9 times, you could do it however many times you want, or you could do it until they feel warm. And then cooling heaven is kind of the opposite. So we want to reduce, or we want to cool, or we want to release excess yang. So we want to, you know, in this case, we connect with the chi, and then we come up strongly, and then go down, connect with the chi, up strongly, go down slowly, up strongly. So the emphasis is on the up. And so this we would do 8 times. So those are just some examples, which I could demo, but I wanted some of this other technique. We don't have like a ton of time. We're actually over time technically, but we started like 10 minutes late. So anyway, we'll just do a demo. I think, where's Doug? He wanted me to needle him. Is he around? He's been in and out.
Do Marcy.
I could.
Marcy.
I wanted to demonstrate this motor point thing because it's kind of exciting, and Doug had an issue that I know of. Anyone has like severe, like a lot of shoulder tension, neck shoulder tension?
I know that my arm would work for this.
But we fixed it already.
That's true. I have nerve damage in my shoe.
In her shoulder.
It depends. So yeah, I kind of just wanted to demonstrate this one motor point technique because it's kind of interesting. And oh, Doug's here.
Oh, you knew.
Okay, you made it back. We need you now. Listen to me now.
Hold on.
Oh my God.
It's a long story. My daughter had never seen that one, and you can't exist in this world without listening to Linda.
He's ready for you.
Okay, I'm ready for you as a demo. Okay, and you know, I'm just joking. Take off your outer shirt, just the jacket for now. And we'll position.
Deal.
Actually, maybe I'll set this here. Okay, so we'll check both sides, but anyway, so Doug has, I'm gonna move this out of the way. Pretty severe, you actually don't have that much pain in your neck, a little bit, right? You have, I mean, he has a lot of muscle tension, very common, this is a very common thing, in the upper trapezius muscle here, rhomboids here. But the problem that he's having numbness now coming down the arm, which arm is it?
Both.
Both, one side is worse or no?
Well, these two fingers are numb,
Uh-huh.
numbness, and these two, like I just did that and had some shooting pain right there.
Yeah, so, you know, he's exhibiting signs of what's called cervical radiculopathy, basically compression of these cervical, mostly C6 and C7 area of cervical spine into the beginning of the thoracic. And so when these muscles are very tight, they can pull, push, compress the disc, causing numbness. Whenever you have numbness, that's a nerve issue or tingling. And so, you know, the origin point would be here more so, like this is more what we're concerned with here. But just as we were assessing him and looking, okay, this feels really tight up here, and we did overall shoulder assessments, and we saw that he had this one issue. So with your arm totally straight, left arm, and then come out here, lock your elbow, come in all the way to the middle, and then press up. Make sure your arm's totally straight, and then come into the middle, and now press up. So he doesn't have the strength there. So this is like, there's a natural compensation pattern. If he comes out like that and presses up, he can do it because then he's recruiting other muscles. But when we isolate this one muscle, arm totally straight, come in all the way to the middle, press up, there's no strength there. There's a little bit, it's firing about like 20% strength, I would say. But anyway, so this is, we're going to do an example of this, what's called motor point acupuncture, one of the orthopedic acupuncture, modern acupuncture techniques. So basically with muscles, there are what are called antagonist muscle groups. So for example, when I flex my bicep, the tricep is relaxed. When one is flexed, one is flaccid, like it has to be that, it's like a seesaw, right? So this muscle here, the upper trapezius and the rhomboids here, these two muscles are the antagonist muscle of this muscle called the serratus anterior that comes in here, it attaches to the ribs, and then it comes underneath the shoulder blade to attach to these other antagonist muscles. So the serratus anterior is a muscle that's responsible for shoulder strength and shoulder stability. It's the main muscle that stabilizes the shoulder girdle, actually. And this is a really common situation, really, really common. Why? Because so many people have really tight upper traps and rhomboids. We can say it's postural, we can say it's stress, right? But really, really common. If you look up what's called upper cross syndrome and lower cross syndrome, basically that describes this postural pattern that is like the modern predicament, that there's a very common postural patterns, right? And so in the upper body, this is a really common postural pattern where we have these muscles are so tight and overused and strained. These ones are really taut all the time, the upper traps and the rhomboids, so that this other muscle becomes really weak to the point of where it's not even firing at all sometimes. So it's so weak. In this case, it's so weak because these ones are so tight, basically. And so in terms of like restoring his shoulder function, we need to get that muscle engaged again. We need to get that muscle engaged again so that the shoulder is going to be stabilized, and then we still need to go and release the muscle tension up in here and all that. But you can get a lot of treatment. Like let's say for him, the neck and shoulder pain bothered him a lot. It doesn't really seem to that it bothers you a lot, even though I feel it's really tight. But a lot of people are like this. They're just used to everything being so tight. It's like normal, right? But there's other effects of it, that it's actually destabilizing the whole shoulder because these other muscles are so weak. So anyway, we want to activate that muscle, the serratus anterior, which we can do through motor point acupuncture. Okay, so I'll demo that motor point acupuncture, and then let's check the other side. So that side had a problem, but then let's see if this side has a problem. Arm totally straight, come into the middle, press up. That one's probably even worse. Lock your elbow, press up. So once we get here, press up. no problem, because then he's using other muscles. But up here, it's only this, we're isolating the serratus anterior and there's no strength. So we're gonna basically try to activate the serratus anterior using motor point acupuncture, and then we'll retest to see if that restores. If we do it properly, it should restore the normal function of that muscle. So I like to do this with you laying out on your side. I didn't really prep for this part, fully, to be honest. Oh, yeah. Okay, that's
first.
Yeah.
And I can grab she. We can vote one.
Am I really gonna be healed tonight?
I have the same
I have no muscles.
So this is not going to actually totally cure the wrist thing, because we do have to release this muscle tension and get the normalize
The
the circulation.
numbness
But
is real, honestly.
I know. But this is just one part of the overall picture. This is just fixing the overall shoulder function. And then like later we will have to, where do these legs come from?
Yeah, this is a little different.
Thank you. Just one.
Do you want me to go to sheet?
I think it's okay. We can just clean the table after. So for this part, if you would take off your shirt and you can go on your side, either side. We're gonna do both.
This is what I should have had a zipper shirt.
Yeah. And then you can go on your side. I'm just gonna wash my hands up here. That's not beautiful.
Looking good. Why not?
Okay, your calendar photos right.
You don't have to take your pants off. Right?
Why not?
Wrong class.
Okay, so if you guys want to come stand up and kind of gather around here to get closer.
I need some more. Acrobat.
Yeah, oh yeah. Can you try to position this in a good
Yes.
position? Oh, I guess you need to see that.
Yeah.
Okay. Let me slide this under your head here.
Nice.
Yeah.
Oh, man.
Yeah, let's do that. I got that.
Thanks for volunteering. Hope you get a good result.
Oh, yeah, thank you.
We're pulling for you.
How do I receive that?
So you're on that, open this up.
Okay, thank you.
Yeah.
So should some of us come around the other side?
I would say, yeah, let's move the whiteboard first. I would say, yeah. Yeah, most should come on this side, I would say, yeah. And then maybe you can also come on that side closer. And if you guys have to go now, it's totally fine. If you want to stay, you should come up and check this out. It's gonna be kind of weird.
Oh, no, it's gonna be bizarre.
It's gonna be a bizarre freak show. Okay.
Okay, so what technique are you using?
This is a motor point acupuncture technique, one of the orthopedic acupuncture techniques. It's actually going to use electroacupuncture.
Okay.
Electroacupuncture. Okay, now time. Okay, so we're treating, this is an orthopedic acupuncture technique, modern acupuncture technique, motor point acupuncture technique, where we're going into this muscle that's basically not firing properly at all. So we're going to neuromodulate, a word that we learned earlier today, neuromodulate this area by basically turning on, doing a slight electrical impulse to activate this muscle. And so when we do this properly, it's not painful, but what Doug will feel is basically like he'll feel like the muscle flexing involuntarily when we stimulate this. So we're going into what's called the motor point of the muscle to stimulate the motor nerve, to stimulate the firing of that muscle. So we're basically reconnecting this muscle with the brain. Okay, so it's a little bit uncomfortable for me to kind of squeeze around. That's the uncomfortable part. So that helps. So sometimes this takes a little bit of like poking and prodding to actually isolate it. Different ways we can do this. This case comes up a little. Yeah, so that. Okay, that's pretty. I know it's not. This is kind of uncomfortable. Sometimes I have to do a few different, slightly different locations to see where I can get a good reaction.
Can I just say that massage therapists are rougher?
Yeah. And basically with this technique, we're basically using the needle just as a conductive object. We're not doing a lot of needle technique. We're just using it to then stimulate it with this electrical impulse. So, yeah, okay, so this is a pretty good place.
Yeah.
So let's see, you guys have to get a little bit closer.
Can I turn the lights brighter?
Yeah, as bright as you want, yeah. So, let's see.
These are turned off because he has to
So
turn
that's
off for them.
that device in your hand, just you touch the end of it to it.
Yes.
Yeah.
So he's feeling it, I can feel it, but it's not as
It's,
strong. Let's see.
It's less than a TENS machine.
Yeah, let me see if I can go up with the intensity a little just to. I mean, this is a good activation. I don't know if you guys can see the muscle moving.
Yeah. it's
Oh, yeah.
twitching.
You see it twitching, right?
Yeah.
Sometimes it can be even more dramatic where we see the whole. I could do a slightly different position to get a more dramatic
Let's do
display.
that.
We could try that, yeah.
Just show the audience, please.
Yeah, I'll try.
No, seriously.
So I'll try just like a little different insertion method to see if we can get a more dramatic display for the audience. Okay, there we go.
Yeah, yep, that's a good one.
So you can see this whole shoulder move, right?
Yeah.
Oh,
So-
yeah.
On, off, right? And so when I hold it, you see that shaking.
That's a good one.
Like, I don't need that dramatic of a in order to do it properly, but I like it. I like to see it because I know I'm getting it. There's no doubt.
What if the person's super
Squeamish?
dramatic?
They can be. I've dealt with a lot of
Do
dramatic
you use
people.
this on the dramatic people? Maybe.
I do.
You were like,
I try to use the most intense techniques on the most dramatic people just to
Yes.
rattle things up. You know,
Get
shake
them
things
back
up.
to the Tao.
Exactly. Look at that. Yeah.
Yeah.
See, like, right? So
Yeah.
again, this muscle goes underneath the shoulder, but it comes up here and over here as well. Originates in here. So it connects with all these ribs, very big muscle, serratus anterior. We don't talk about it a lot, but it's a very important muscle for stabilizing the shoulder. So when you have like chronically hunched shoulders, that can be a problem with the serratus anterior being turned off. And again, very tight, overused, overstrained upper traps and rhomboids. We're pretty much done. I've been doing it a little, like usually I'll do it
That's
For-
just one needle.
one needle. Yeah, you can
Huh.
feel it in like all different spots probably.
Yeah.
Yeah.
Hmm.
So we're neuromodulating
Hmm.
this muscle.
Wow.
And again, all of the associated muscles that it's connected to.
So when's he gonna feel the
Yeah, so
the
again, this is
sensation
actually-
return to his fingers?
We have to do more work.
Yeah.
This is like not even, I wouldn't even suspect that this would make a difference in that actually. But in describing the constellation of what's going on, he has really tight upper traps and rhomboids. Those tight muscles are compressing the cervical spine here, and they're also over time there's this pattern where this muscle is not working, so the shoulder is not stable. So this is more of like a long-term kind of fix.
Right.
That one of the things that we would do, I would do different techniques. I would do acupuncture, you know, on the hands, legs, here, like different approaches I could take, right? But we want to release this area and treat that nerve directly. This is more of like a root treatment, but we actually need to treat the branch as well, which is that he has this compression here.
Yeah.
So this is just to fix part of the underlying pattern, but it's not the only thing we would need to do.
Oh, wow.
And that's a strong one. So this is enough. I mean, I'll usually do it 8 seconds for 8 seconds 4 times or something like that.
Doug, what are you feeling?
When the electrodes in?
Yeah.
Just
It's like a really strong
tension.
Involuntary
Yeah.
muscle contraction.
Muscle contraction. It's not painful, right? I mean, it's not
No,
painful. It
no.
just feels like
Yeah.
kind of like a activation, like
Yeah,
you're
yeah.
flexing your muscle.
Yeah.
So that's so much more, you know, directed than when they put those little patches.
Yeah,
on
exactly.
there.
Because the patches are just at the skin, right? So
Right.
when we use the needle, we're going deep into the muscle. So then it's bringing that electricity deep
It's
into the
definitely
muscle. So
deeper.
totally different.
It's
Wow.
very deep.
TENS unit, I think it can help, but again, it's like it's very superficial.
So do they use this for athletes?
They do, but they should be doing it more for athletes. I've treated professional athletes who are or like Olympic weightlifters, and they're doing all these high performance, you know, lifts, and some of them this muscle's not working at all because the body is really amazing at adapting and compensating and doing, you know, recruiting other muscles to do the work. And so, you know, but then all of a sudden when I activate this muscle, their overall strength increases a lot,
goes up.
although it actually takes them time to learn how to use that muscle because it hasn't been used for a while. But yeah, it's interesting. You know, they're like literally high performance athletes that like several of their major muscles are not even firing at all.
Wow. Okay,
Yeah.
so the Olympics, another 4 years.
Olympics would be yeah. Right. I don't even like this technique is really not that common. Okay, so let's recheck it now. So the needle's out. Come sit up. We're gonna fix the other side while we're at it too.
You wear your shirt?
So did you make his back red or his?
No, his back is naturally red.
He's doing the other
Either
side.
way.
Internal heat. Yeah.
Are you doing
Sit
that?
up. Let's recheck it first.
Okay.
Yeah, we can go that way.
I know you say you're not laying on, I'm sorry, synthetic material.
So we did the left side first, right?
I don't. wanna
Okay,
use
so
my
arm
side.
totally straight, lock your elbow, make sure it all the way into the middle and press up.
No.
This one? Is this the one we did?
No.
The other one, okay, that's what I'm like, that doesn't feel strong. Okay, arm totally straight, lock your elbow, press up.
Okay, guys.
So that's
Wow.
Oh, yeah, that's me too.
Press up. So now I'm pressing as hard as I can push down. So then just to compare it to this side that we haven't fixed yet, arm totally straight, press up. So that one's no strength. So no, we'll just fix this
Not
one
an
over.
evangelical trick.
Yeah.
That was really fine.
Well, and I'm pressing as hard as I can on this side. On this side, I'm pressing not so hard. Okay,
Thanks a
so
lot for
let's fix
making
the other
me
side
feel
while we're at it.
You're gonna fix this one?
Yeah, let's do it.
Oh, gosh, thank you.
Yeah.
Uh-oh.
I'll come around to this side this time. You guys can come around this way, maybe. Okay, yeah. Come with this arm out like that.
Can I go up on that?
Yeah.
You feel that, huh?
Oh,
Tender?
yeah. Mm-hmm.
Is that tight?
Oh, yeah. So, you have a small electrical wire attached to that? Or-
Actually, no wire attached. I just am basically touching this electrical pen, basically. I don't like that.
Oh, okay.
But you could also do like there's like electrode, like alligator clips you can use as well. But this one is very like specific. I'm able to know
touch-
right away if I'm
just
doing it.
touch
Just
the
touch
needle.
it. Yeah.
Yeah, it's very,
I know. Sorry.
it's very tense. How deep does the needle go? I'm just
Kind of
curious.
depends on which insertion style I do, but it's going about 3/4 of an inch.
Hmm.
There we go. That's a strong one.
Yeah. And by stimulating it,
Mhm.
doesn't it improve blood flow to that area?
For sure. Yeah. But this problem is so common, so common. Like my teacher with the motor point acupuncture teacher said that, you can build a whole practice just on doing this. If you only did this, you could be successful, because so many people have this pattern. Like they have really tight, upper traps and rhomboids, and this muscle turns off, and they have shoulder problems, and then they have rotator cuff tears and a host of other issues down the
Like
line.
painters, I've heard.
For sure, definitely.
That's when it all started, when I started painting.
Okay. So, painting, you're lifting up, right? Straining these muscles.
Changing out light bulbs.
He replaced all the lighting in my house. Because he said it bugged him and I really needed it. I was like,
I
okay.
have a workers' comp claim going on here. It's all documented on the video right now. It's like, what,
And all the
$50,000
witnesses.
$50,000 worth of pain and suffering at least.
Yeah.
We have no written agreement at all.
Yeah, but it took place on this residence. So. Oh, gosh.
No matter who
Yeah,
signed
yeah,
it.
keep
That's very
shocking.
painful.
75
pain
now,
zone.
75,000.
What level of pain?
With my hand.
Will it shock you?
Thank you.
I don't know if I love this
have
sensation that we're
great
getting, but we'll check it anyway after.
What is it? Oh, oh gosh.
I thought the vibrating
like
thing
I'm
felt
gonna
really
die.
cool. You did this on me too.
No. But her hands are very warm. You hold his hands. No, you.
Okay.
Yes.
His hands are warm too.
No.
Big hands.
I'm just.
Okay, let's see.
have the
I
energy.
don't know if we got it totally with that, but we'll check.
Oh, God, that is amazing.
Let's see. Okay, sit up, the needle's out.
Oh,
Okay. You have a final
Left
set.
side now. Yeah, come this way.
See if it works.
Yeah, so I'm not sure if we got enough stimulation on this one, but we'll see. Arm totally straight. Yeah, come up, press up. Okay, yeah, that's great. Make sure your elbow's totally locked too. Straight, yeah, press up. Yeah, 100% strength. It's perfect. Yeah. So now both sides are good. And this is one of the exceptions to the rule that healing takes time, because this is actually a one-time fix. Like when we do activate the muscle, it's good to go. Over time, that postural pattern can reemerge over a long enough time. But that's good. But then the other stuff will take longer time. You're supposed to pay me. Yeah, to release the tension here, to normalize the circulation, that will take a little bit of time. But that, restoring the shoulder function is done with that.
So how long will this last?
We will recheck in 2 months.
Oh,
I would recheck in 2 months.
Wow.
So you did it as well.
Dude, yeah.
Yeah.
I mean, it's gotta
Almost
be-
like so many people have it.
In 5 minutes.
well, no, he did the same thing on me, Seth did.
Oh, yeah.
Because my traps were super tight. I didn't even know it. He tested me. I had no strength.
Probably half of the people in this room at least would have it. We can check. I mean, we could do an assembly line. You want to check?
Yeah, oh, yeah.
Okay, so sit down.
Okay.
Well, I don't think that's the only thing. I think it's.
Well, so that's it for the class, by the way. That's it. Thank you guys for coming. If you guys have any questions, I'll hang out for a little bit.
Do you want to keep
Yeah,
this
I
going?
didn't complain.
Do I just-
Press up.
Of tightness in my shoulders, but they were.
Yeah, you
super
press
tight.
up. Yeah, you do have it. So here you have strength. Press up.
Now
So yours is firing a little bit, but not that strong. Press up. Yeah, see, you should be able to resist all my pressure. Press up. Like here is fine, but it's more here. Press up. So yeah, you're firing at you're firing like 50 to 60% strength, but we could still fix it. We want to see 100. Anyone else want to see if they,
Yeah.
they have this particular specific problem?
Just for curiosity.